a plan of action, because we want to send the message that MSPSS, which is mental health and psychosocial support, is coordinated by different agencies.
Coordination in mental health really means getting everybody together, everybody becomes involved.
O envelhecimento abre um mundo de possibilidades. A possibilidade de continuar fazendo o que amamos e ser quem somos. Mas, sem o suporte adequado, o envelhecimento também pode trazer limitações. Saúde debilitada, vulnerabilidade, solidão. Acreditamos que em um ambiente seguro, acolhedor e solidário, pode transformar o envelhecimento em uma oportunidade para ser saudável, para viver plenamente, para aceitar a mudança e continuar aprendendo e se desenvolvendo. Acreditamos que todas as pessoas têm o direito de prosperar em qualquer idade, adicionando dignidade aos anos, bem-estar aos anos, vida aos anos. Década do envelhecimento saudável nas Américas. Adicionar vida aos anos.
Vivemos em um mundo que está evoluindo mais rápido do que nunca e no qual a expectativa de vida aumentou 20 anos em meio século. Pela primeira vez, a sociedade e a tecnologia avançam mais rápido do que a vida de uma pessoa ou de uma geração. Nunca antes, 6 gerações compartilharam o planeta. Gerações que nasceram antes da existência dos antibióticos, hoje convivem com gerações mais jovens que nasceram em plena revolução biotecnológica e de alta conectividade social. A aspiração é que esse presente de 20 anos na expectativa de vida se traduza em um benefício e não em um fardo. O fato de as pessoas viverem mais, permanecerem doentes por mais tempo e, portanto, ficarem mais tempo vinculadas aos serviços de saúde são motivos que demandam novas abordagens. O ganho de 20 anos a mais na expectativa de vida exige que as capacidades físicas e mentais da população sejam plenamente desenvolvidas e que durem por mais tempo. Isso permite não apenas sobreviver, mas prosperar e contribuir ativamente para essa transformação rápida e exigente. É por isso que a saúde não pode ser considerada apenas como uma aspiração abstrata, mas deve ser entendida e medida como um recurso e uma capacidade tangível. Entender que a saúde não acontece por si mesma e que deve ser construída ao longo da vida, ao mesmo tempo que é influenciada por condições sociais específicas, é essencial. O documento Construindo a Saúde no Curso de Vida busca motivar a academia e as estruturas de saúde a olhar para a saúde por meio dessa visão inovadora. Mas, além disso, pretende motivar a aplicação da abordagem do curso de vida na prática da saúde pública para, assim, abordar melhor os fatores que influenciam e determinam as trajetórias de saúde de indivíduos e populações e, consequentemente, a sua capacidade de desenvolvimento humano.
Americas, a dynamic region full of diversity, and yet the most unequal in the world. 201 million people still live in poverty. Illnesses such as obesity, diabetes, hypertension, and high cholesterol are more prevalent among poor and vulnerable populations. The mortality rate is twice as high for children under 5 with undereducated mothers. And every year, 2 million babies are born to mothers between the ages of 15 and 19. It is our duty to protect those who are most in need. We will do whatever is necessary to ensure that no one is left behind. We've been doing so for over a century, and we're not going to stop now. Because our determination doesn't stop. Our dedication doesn't stop. Our commitment to our communities doesn't stop. And because life doesn't stop. Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubeola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan American Health Organization.
Aunque no lo sientas, está aquí. El aire que respiramos es un derecho. 9 de cada 10 personas viven en ciudades con niveles de contaminación que exceden las recomendaciones de la Organización Mundial de la Salud. La contaminación del aire no tiene fronteras. Es un problema global. que produce inflamación de las vías respiratorias, enfermedades cardiovasculares, neurodegenerativas, nacimientos prematuros y envejecimiento de la piel, y acaba con la vida de aproximadamente 7 millones de personas por año. Podemos reducir los niveles de contaminación exigiendo leyes que limiten la emisión de gases y partículas, utilizando modos de transporte limpios, haciendo una buena disposición de los residuos, optando por la eficiencia energética. Eres parte de la solución.
La région fait face à une immense crise à cause de la chute du nombre d'enfants qui reçoivent tous les vaccins. En 2021, aux Amériques, 2,7 millions d'enfants de moins d'1 an n'ont pas reçu ou complété leur série essentielle de vaccination due à l'interruption des services de santé provoquée par la pandémie de Covid-19. Aussi, la pandémie a aussi touché la surveillance de ces maladies et des systèmes de laboratoire. La région pourrait n'être pas capable de détecter la prochaine émergence d'une maladie évitable par la vaccination avant qu'elle devienne une pandémie multinationale. Dû à la relation étroite parmi les épidémies et la vie en société, nous faisons face à un risque pas seulement sanitaire, mais aussi bien qu'un risque économique, éducatif et social. Nous avons besoin de réduire le risque d'importation et de propagation de maladies qui ont été éradiquées des Amériques, comme la polio, la rubéole ou le tétanos néonatal. Pour réussir, les États membres, les partenaires et l'Organisation panaméricaine de la santé devons travailler ensemble pour renforcer tous les aspects des programmes d'immunisation en investissant ces ressources financières et en augmentant le nombre de personnels formés qui puissent assurer des services d'immunisation et son intégration au système d'attention primaire de santé. Ceci seulement arrivera si les gouvernements et les partenaires forment des engagements politiques et économiques pour arrêter ces écarts d'immunisation. Comme principal collaborateur de la région dans tous les sujets de santé publique, l'OPS est complètement capable à aider aux États membres pour privilégier leurs besoins les plus urgents et exécuter des actions en faveur de la vaccination. Nous continuons avec notre collaboration fructueuse pour renforcer les programmes nationaux d'immunisation dans toute la région. C'est possible de surpasser cette crise, ensemble. Nous y avons réussi dans le passé et nous allons le faire encore une fois. Organisation panaméricaine de la santé, 120 ans. Nous sommes l'Organisation panaméricaine de la santé, célébrant 120 ans de solidarité dans la promotion de la santé et du bien-être des personnes, sans laisser personne de côté.
The pandemic has impacted many, but not everyone in the same way. Women and girls of all ages weathered the crisis with increased caring responsibilities resulting from unequal gender roles.
The 19 pandemic has been difficult on us all, especially on our young people. It has affected our educational system. Students, both old and young, became subject to learning remotely, not being able to socialize with our friends, with our peers, with our loved ones, has affected us both mentally and emotionally.
In the region of the Americas, over 10,000 healthcare workers lost their lives responding to COVID-19, many of which were women who comprise 70% of the frontline care and represent only 25% of managerial positions. Yet, men have shown higher mortality rates due to COVID-19, including disproportionate infection and death in certain ethnic groups. Gender and masculinities shape their health outcomes and that of those around them.
La pandemia del COVID puso a prueba el mandato de la masculinidad que nos dice a los hombres tienes que ser libre y estar fuera del espacio doméstico. Al no poder hacerlo, provocó en los hombres mayor tensión, irritabilidad, frustraciones, enojos, malestares, que los hombres aprendimos a no expresar, a acumularlos. Ante esto, los papás podemos aprender a ser afectivos, asertivos y diversos en la expresión de nuestras emociones y malestares a través de ser corresponsables, afectuosos, procurar cuidados, tiempos, comunicación con respeto.
A reality of our region is that pre-existing systemic inequalities endanger COVID-19 health outcomes and affect the resiliency and recovery of communities and countries. In our response to the pandemic, only 24% of women sit on national task force, whereas they are responsible for 80% of domestic tasks, including caregiving. Ensuring gender equality in care economies must be the foundation of building resiliency and sustainability.
Do we even know the true impact of the pandemic on women? We need to be in the lead. You and I champions for the universal elimination of gender and health inequities during pandemics and beyond. I know that there can be no sustainable development without gender equality.
Diabetes is a global epidemic and a major public health problem in the Americas. That's why PAHO is implementing the Global Diabetes Compact, a new framework to improve diabetes prevention, diagnosis, and treatment. It starts with improving type 2 diabetes prevention and early diagnosis of type 1 and type 2 diabetes, and learning from people living with diabetes, enhancing the quality of care for people living with diabetes through treatment and prevention of complications, improving monitoring of people living with diabetes and measuring trends in diabetes, with the goal of reducing the risk of diabetes and ensuring everyone living with diabetes has access to quality, comprehensive, and affordable care. Learn more about PAHO's regional implementation of the Global Diabetes Compact in the Americas to create synergies for action and harness the collective capacity of partners working with countries to improve diabetes prevention and control across the Americas.
La salud es el recurso más valioso y un motor del desarrollo sostenible. Ayuda a cerrar brechas y a eliminar inequidades. Invertir en sistemas de salud resilientes es vital para la recuperación y la preparación para el futuro. Pero ninguna organización o nación puede abordar los desafíos de salud en las Américas por sí sola. Somos el socio de elección para promover la salud pública y el mejor instrumento para mejorar la calidad de vida de nuestras poblaciones. Tenemos cobertura en todos los países, capacidad de gestión y monitoreo de proyectos a nivel regional y nacional, conocimiento y redes en todas las áreas de salud, capacidad para convocar, mecanismos de transparencia y experiencia en dar respuestas a emergencias. Las alianzas han sido esenciales para mejorar la salud en la región. La esperanza de vida aumentó 36 años. Las muertes de niños menores de 5 años se redujeron un 67%. Miles de millones de personas se han podido vacunar y acceder a medicamentos. Se eliminó la viruela, la poliomielitis, la rubéola y el sarampión. Cada éxito demuestra lo que la colaboración puede lograr. Pero todavía queda mucho por hacer. Las vidas de muchas personas dependen de nosotros. Llevemos juntos salud y esperanza a cada rincón de las Américas. Organización Panamericana de la Salud.
Frente a la creciente crisis de salud mental en el contexto de la pandemia COVID-19, la OPS ha incorporado la salud mental en su respuesta a la emergencia por COVID-19. El programa NH pretende reducir la brecha de acceso a los servicios de salud mental, capacitando a profesionales de salud no especializados para que puedan identificar, manejar y referir a personas con condiciones de salud mental.
El curso MHGAP nos dio varios aportes. Uno de ellos fue el fortalecer conocimientos. Algo fundamental también fueron los indicadores de salud mental.
Entonces, el curso está diseñado de tal manera que podamos nosotros tener una estructura apropiada para dar la capacitación, dar el seguimiento, dar la supervisión y que el personal del Ministerio de Salud Pública tenga acceso a este tipo de información y pueda hacer una evaluación, un diagnóstico y un tratamiento en las comunidades.
El curso se da mucho en este énfasis, en esta parte comunitaria para poder disminuir la brecha de atención y más ahora en este periodo de pandemia.
Por ejemplo, un aporte importante que yo rescato mucho es la conformación de un equipo operativo a nivel de gestores en la parte local. Los gestores que gestionan medicamentos, gestores que tienen que ver con los recursos humanos, con un sistema integral de salud.
Entonces, lo que se quiere es iniciar el trabajo allí de tal modo que en cascada se vaya difundiendo la guía MHGAP.
En el Hospital de Salud Mental se implementó la utilización de llamadas telefónicas para darle seguimiento a los pacientes. Junto con otros colegas, somos partidarios de esa transformación de la salud mental que tiene que existir en nuestro país y a nivel mundial. Haya un tratamiento en la comunidad, haya un tratamiento con el idioma, con las condiciones de cada persona.
Cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases are known as non-communicable diseases. In recent years, these diseases have increased as a result of population aging, urbanization, globalization, and changes in lifestyles, and they've become the great epidemic of our age. Non-communicable diseases can largely be prevented by adopting a healthy lifestyle, but to do so requires more than simply personal determination. For example, when wholesome food is more expensive and less available than junk food. When physical activity is a challenge because the parks and recreation areas are not safe or properly equipped. or when it's hard to quit smoking or drinking because advertising of these products seems to be all around us. That is why laws and regulations are needed to make the healthy choice the easiest choice. Without these laws and regulations, more and more people will develop a non-communicable disease and need lifelong treatment that could ruin them financially. But there's still time to stop this epidemic from growing, and some countries in the Americas have already taken action by, for example, reformulating processed foods to make them healthier, informing consumers about the nutrition content of packaged foods, making more fresh foods available, regulating the sale of junk food in schools, as well as providing free drinking water, increasing taxes on tobacco, alcohol, and sugar-sweetened beverages, facilitating access to quit smoking programs, banning tobacco use in enclosed public spaces, and limiting the advertising of cigarettes, alcohol, and junk food. Creating opportunities for physical activity, including creating recreational bicycle paths and promoting the use of public transportation. Governments should ensure access to health services for its population, including access to early detection of disease, diagnosis, medicines, and treatment provided without discrimination and without undue financial hardship. People should be provided with information and support that empowers them to manage their own health, giving them greater control over their health and contributing to the health of their families. This way, all together, we can stop this terrible epidemic.
Good morning, muy buenos dias, bom dia a todos. França é número 21. Nós estamos quase lá. Ai, eu vejo Gaiana entrando na sala. Confirmando. Perfeito. Muito bom dia a todos. Mr. President, we're ready to go. Ready to go.
Okay. Buenos dias. Bom dia. Good morning. Bon matin. We are now in the final throes of our meeting. Hope to get finished today, this morning. For anybody who has a hotel room here, we need to finish before noon because that's checkout time. So we're going to try to see if we can get through all our agenda without requiring a health or coffee break, but we'll see how it goes. So as you know, based on yesterday's, as we ended yesterday, we have just 2 items left, but each item has a multiple element to it. Item 8.12 is our first. Progress reports on technical matters. Document CSP 30/INF/12. A series of progress reports, and we'll take them each individually. The first one will be the sub-item A, Plan of Action for Cervical Cancer Prevention and Control 2018-2030 Progress Report. And Dr. Hennis, if you're in the room, come on up. And I will turn to the Executive Committee representative to report on this item. The floor is yours.
Thank you, Mr. President. Good morning, everyone. In the Executive Committee's discussion of the progress report, delegates reaffirmed their support for the plan of action and their commitment to controlling and eliminating cervical cancer as a public health problem in the region. They also expressed support for the actions recommended in the report to improve the situation. Several delegates noted that the impact of COVID-19 pandemic on access of HPV vaccination, pap smear testing, and oncologic diagnostics and treatment services, and underscored the need to build more resilient health systems and services capable of sustaining such services while also responding to a health emergency. The need to strengthening digital cancer registries was also emphasized. In addition, delegates highlighted the need to address persistent myths and misconceptions about HPV vaccination. Thank you, Mr. President. This concludes my report on this item.
Thank you. Open to delegations for comments. Anyone like to comment? I recognize Antigua and Barbuda, followed by Canada.
Thank you, Mr. President, and good morning to delegates. Antigua and Barbuda thanks the Secretariat for this progress report on the Plan of Action for Cervical Cancer Prevention and Control in document CSP 30 Information 12. Cervical cancer prevention and control remains a priority for the government of my country. And over the last few years, we have taken steps to establish a comprehensive cervical cancer prevention and control program. In terms of governance, we have reconstituted our cervical cancer task force that oversees the organization of our program. Members are responsible for prevention, screening, and treatment for cervical cancer. And in terms of prevention, the HPV vaccine was introduced in 2018, and uptake was better than expected until the COVID-19 pandemic, when we saw a decline in persons being vaccinated. Therefore, between 2018 and 2020, we utilized about approximately 3,800 doses of HPV vaccines. We are now taking steps to improve HPV vaccination uptake. We are pleased to have been working with PAHO and Basic Health International over the last few months on Antigua and Barbuda's Elimination of Cervical Cancer, or ABC plan, which seeks to achieve 50% vaccination of girls between the age 9 to 13 years old by 2023, and to screen approximately 50% of women between the ages of 35 to 45 years of age, or approximately 5,500 women by 2023. This comprehensive plan includes clear guidelines and referral pathways for screening and treatment. It is hoped that there will be increased efficiency with a decrease in the time from screening to treatment. We will also establish a central cervical cancer database. A pilot project was launched earlier this month in 5 community health clinics. And to support the implementation of the project, the Ministry of Health and Wellness convened an HPV testing and treatment program, becoming the first country to implement WHO's training manual. We were able to procure HPV tests and a gene expert machine from PAHO for the project, and we extend gratitude to PAHO for its technical assistance, as well as for the equipment and supplies needed for this initiative. The pilot will establish key structures and processes necessary for a full-scale national program, and is being employed in parallel with community engagement and a communication strategy aimed at ensuring the design is fit for purpose and that uptake is optimized. The ministry has already taken steps to ensure that this pilot transitions into a permanent program offering HPV testing for all women as needed. In terms of treatment, women have access to chemotherapy free of charge, and radiotherapy services are available in country and are subsidized by the government. Palliative care is also provided in the private sector if needed. Despite the progress made, more needs to be done. We need to improve the education and information provided to women and integrate HPV vaccines into the national immunization schedule. We also need to fully establish a population-based cancer registry and increase HPV vaccine coverage. We know the report and the fact that areas of concern to us have also been identified by PAHO as areas where there have been no progress. We therefore request PAHO to intensify its assistance in these areas. This will facilitate Antigua and Barbuda's progress where there has been identified gaps and deficiencies. Thank you, Mr. President.
Thank you, Antigua, Barbuda. Canada, followed by Suriname.
Thank you, Mr. President. Canada would once again like to thank the Secretariat for this important update on the Plan of Action for Cervical Cancer Prevention and Control. It is heartening to see global action on this preventable issue, and Canada remains committed to this plan of action, as well as the global strategy to accelerate the elimination of cervical cancer as a public health problem, adopted by the World Health Assembly in 2020. This plan of action also aligns with the Sustainable Development Goals and other global commitments, such as the recently adopted WHO Global Health Sector Strategies on respectively HIV, viral hepatitis, and sexually transmitted infections for the period 2022 to 2030, which include HPV vaccination and cervical cancer screening targets. Canada would like to take this opportunity to underscore that any and all actions taken to prevent and control cervical cancer must put equity and gender equality at the forefront. These efforts must also include all people who have a cervix, including some transgender men, some non-binary people, some intersex people, and others who may not identify as women or girls. Canada continues to strongly encourage the integration of culturally responsive cervical cancer prevention and care and sexual and reproductive health services, so that every woman and adolescent girl in all their diversity, as all other people with a cervix, have the opportunity to access quality cervical cancer prevention and control health services. In the future, we would encourage that these progress reports take into consideration an equity-based and inclusive approach, as well as underscore its importance in order to achieve the targets and goals outlined in the plan of action. Thank you.
Thank you, Canada. Suriname, followed by Brazil.
Thank you, Mr. President. Prevention and control of cervical cancer is very relevant for Suriname, given the fact that cancers are the second leading cause of death in Suriname, and cervical cancer is the second leading cause of cancer deaths in women. Suriname has one of the highest burden of incidence and mortality from cervical cancer in the Caribbean, with an age-standardized incidence rate of 23.7 per 100,000 and an age-standardized mortality rate of 14.1 per 100,000. In 2020, the coverage of screening of women between 30 and 49 years was only 32%, and the HPV vaccination coverage in girls up to age 15 years was 38%. PAHO supported the Ministry of Health with the development of a national plan for the prevention and control of cervical cancer for the period 21 to 30. Based on the assessment of the situation and the response, the plan identifies the following 4 strategic lines of action and strategic objectives. 1, strengthen leadership and governance in cervical cancer programming. Strengthening primary prevention through information, education, and HPV vaccination. Improve cervical cancer screening and pre-cancer treatment through innovative strategies. Improve access to services for cancer diagnosis, treatment, rehabilitation, and palliative care. These are in keeping with the global strategy and the regional plan of action. Efforts are being made to implement the national plan, especially with respect to primary prevention to the HPV vaccination, improve screening, and equitable access to treatment. Suriname was one of the first countries in the Caribbean to introduce the HPV vaccine for girls routinely in November 2013, but due to persisting myths and safety concerns, the uptake has remained low. The vaccination program offered through schools is now further challenges as parents and girls are now fearful that COVID-19 vaccine will be given to them as well or instead. This has led to an even lower coverage in 21. Suriname has not yet introduced HPV testing, but given the country's context, the expansion of coverage for screening using VIA is more appropriate at this time. While all modalities of treatment are available in Suriname, palliative care at the community or primary care level is still lacking. The country is committed to the implementation of the national plan and will continue its efforts to increase coverage for screening, vaccination, and treatment. Thank you, Mr. President.
Thank you, Suriname. Brazil, and then Paraguay.
Bom dia e muito obrigada, senhor presidente. O Brasil gostaria de agradecer a presente relatório de progresso sobre a questão apresentada essa manhã. De acordo com dados da OPAS, o câncer do colo de útero é a principal causa de morte entre mulheres na América Latina e no Caribe, e apesar de ser altamente evitável, ainda é a causa de óbito de mais de 35 mil mulheres a cada ano na região das Américas. Por essa razão, reconhecemos a importância de seguirmos nosso compromisso como região para a prevenção e controle do câncer do colo de útero como problema de saúde pública e nos manifestamos em apoio às ações recomendadas no relatório apresentado. Acreditamos que o enfrentamento a essa doença deve ser baseado em uma abordagem integral para prevenção e controle e que também conte com intervenções de caráter multidisciplinar, incluindo componentes de educação comunitária, mobilização social, vacinação, rastreamento, tratamento e cuidados paliativos. O Brasil acredita que para o controle do câncer do colo de útero, o acesso à informação e a redução das dificuldades de acesso a serviços de saúde são questões centrais a serem garantidas mediante ações intersetoriais. O amplo acesso da população a informações claras, consistentes e culturalmente apropriadas a cada território deve ser uma iniciativa dos serviços de saúde em todos os níveis de atendimento. Nesse sentido, o Instituto Nacional do Câncer do Brasil desenvolve ações de informação e comunicação em saúde que servem de subsídios aos gestores para o planejamento de suas atividades. Além disso, gostaria de destacar que no ano passado, em 2021, o Ministério da Saúde publicou um novo plano de ações estratégicas para o enfrentamento de doenças crônicas e agravos não transmissíveis 2021-2030, no qual, entre as metas estabelecidas, está a redução em 20% da mortalidade prematura por câncer de colo de útero até 2030. Por fim, reconhecemos o impacto da pandemia de Covid-19 sobre o acesso à vacinação contra HPV, ao exame de Papa Nicolau e a serviços de diagnóstico e tratamento oncológicos. E gostaríamos de destacar a necessidade de se criarem mecanismos, sistemas e serviços de saúde mais resilientes, capazes de manter esses serviços durante a resposta a emergências de saúde pública, de modo a não deixar ninguém para trás. Muito obrigada, senhor presidente.
Obrigado, Brasil. Paraguay, then Cuba.
Gracias, señor presidente. El Paraguay agradece y toma nota del informe CSP 30/info/12. Mi delegación resalta la importancia del plan de acción, cuya ejecución representa varios retos y oportunidades, teniendo en cuenta que es una de las principales causas de muerte por cáncer en mujeres de mi país. A través de la priorización de las 4 líneas estratégicas del plan, se ha podido implementar las actividades del Programa Nacional del Cáncer con el fin de reducir la incidencia y la mortalidad en la población de Paraguay. Asimismo, ha servido en base para definir las acciones que permitieron el establecimiento de un programa organizado desde la prevención primaria a la terciaria, logrando incorporar a la prueba de VPH como tamizaje primario, la cual se halla avalada por resolución ministerial. Paraguay reitera su compromiso con la prevención y el control del cáncer cérvico-uterino. Por ello se encuentra adaptando la estrategia mundial para la eliminación de esta enfermedad a la realidad nacional. Sin embargo, aún nos enfrentamos con desafíos, entre ellos presupuestarios, en los cuales se está trabajando con mayor intensidad para brindar servicios de mayor calidad. Gracias, presidente.
Gracias, Paraguay, Cuba, and then Barbados.
Gracias, señor presidente. Los tumores malignos constituyen una de las primeras causas de muerte en todo el planeta y en Cuba las estadísticas muestran una tendencia similar. De manera particular, el cáncer cervicuterino ocupa la 5ª causa de enfermar y morir en la mujer cubana. Las evidencias demuestran que la infección sexualmente transmitida por el papiloma virus humano es una condición etiológica necesaria en más del 90% para desarrollar el cáncer cervical y del tracto genital inferior. Las acciones de control de cáncer de cervix, incluidas en el programa integral para el control de cáncer vigentes en el país, han logrado una reducción sustancial de la mortalidad por esta causa y abarcan desde la educación, la comunicación, el tamizaje con la prueba de Papa Nicolau, la garantía de diagnóstico y tratamiento de lesiones precancerosas y cáncer, el seguimiento y los cuidados paliativos. A pesar de ello, se mantiene una tendencia al incremento en cuanto a la incidencia. Dentro de estas acciones están identificadas 2 medidas recomendadas por la OMS-OPS, incluidas en la estrategia mundial, para acelerar la eliminación del cáncer del cuello uterino como problema mundial de salud pública. Aún no se han logrado implementar en el país la introducción de la vacuna contra el virus en niñas de 9 a 13 años y la utilización del test como método de pesquisa. En este momento y con la experiencia cubana de producir vacunas contra diferentes virus, se evalúa con la industria biotecnológica Biocuafarma la posibilidad de producir una vacuna nacional que dé respuesta a esta problemática. Respecto a la introducción del test como método de pesquisa En el 2017-2018 se realizó proyecto de familiarización de tecnología que incluyó representatividad en 3 regiones del país. En paralelo, Cuba realiza estudios de costo-efectividad para proponer a los decisores la incorporación del test combinado con la citología orgánica como método de pesquisa. Avanzar en este programa es una prioridad y en tal sentido se ejecutan acciones concretas. Consideramos que puede ser un área de cooperación que debe fortalecerse entre los países del área. Muchas gracias, señor presidente.
Gracias, Cuba. Barbados and then Honduras.
Good morning, ladies and gentlemen. Good morning, Mr. Chairperson, distinguished colleagues. Let me begin by thanking the Director for the progress report on the Plan of Action for Cervical Cancer Prevention and Control 2018 to 2030. Barbados welcomes the support of PAHO WHO in our efforts to reduce the burden of cervical cancer. There is much to be done to improve efforts in prevention, early detection, treatment, and palliation. Given the slippage in implementation identified across the region during the COVID-19 pandemic, in this progress report, it is recommended that PAHO support countries in identifying barriers to achieve the agreed targets. It is also suggested that PAHO continue to promote opportunities for member states to share experiences and lessons learned, and to facilitate collaboration on strategies to improve cervical cancer control. Barbados welcomes the new guidance given by SAGE and WHO, offering a single-dose vaccine for the prevention of cervical cancer. We continue to have up-to-date statistics on all cancers in Barbados through the Barbados National Registry. We are pleased to note that late-stage cervical cancer rates are falling in Barbados. Barbados notes the report and encourages all members to continue to work towards the attainment of an improved country capacity for the sustained implementation of comprehensive cervical cancer prevention and control programs. Continued reporting and support by PAHO in achieving agreed targets is important to ensuring that barriers are identified early and addressed. I thank you, Chair.
Thanks, Barbados, Honduras, and Panama.
Muchas gracias, señor presidente. Honduras está de acuerdo con el informe del progreso del Plan de Acción para la Prevención y Control del Cáncer Cérvico-Uterino. Honduras es uno de los países con más alta incidencia y muerte por este cáncer, por lo que requiere de la cooperación técnica y financiera de la OPS, OMS, así como del apoyo de otras agencias para que podamos lograr que el cáncer cérvico-uterino deje de ser un problema de salud pública y una de las mayores inequidades para la mujer hondureña. En referencia al Plan de Acción para la Prevención y Control del Cáncer Cérvico-Uterino de la OPS, Honduras tiene desafíos importantes para los que requerimos mayor inversión, tanto nacional como de la cooperación internacional. Número 1, establecer un registro poblacional de cáncer que permita evaluar la incidencia, prevalencia y muerte por cáncer. Un subsistema de información de tamizaje y tratamiento para contar con indicadores de país en cobertura de tamizaje y seguimiento en las mujeres con lesiones premalignas en cérvix. Estos nos permiten monitorear y medir el impacto del plan estratégico que se establezca por la eliminación de esta enfermedad. Número 2. Un programa nacional para la prevención y control del cáncer cérvico-uterino que cumpla con tamizaje con la prueba de BPH con la cobertura del 70% de las mujeres en edades priorizadas por su mayor riesgo. Vacunación contra el BPH debe ampliarse el rango de edad mínimo
alcanzar la población de niñas menores de 15 años y establecer estrategias para alcanzar la cobertura del 90% con un registro nominal de las vacunas para su seguimiento. Tratamiento del 90% de las mujeres positivas con lesiones premalignas, enfocándose en la resolución de un tratamiento proporcionado en el primer nivel de atención y en cáncer invasor, mejorar el acceso a diagnóstico, tratamiento con cirugía, braquiterapia, radioterapia, quimioterapia. Cuidados paliativos para la población con cáncer que lo requiere. Muchas gracias, señor presidente.
Gracias, Honduras. Finally, Panama.
Muy buenos días, muchas gracias, señor presidente. Recibimos con agrado el informe de progreso de este plan de acción. En este sentido, Panamá mantiene en la norma de salud integral de la mujer la toma de Papá Nicolau como método de tamizaje, priorizando en mujeres de 25 a 59 años con factores de riesgo. Se impulsa la acogida de la prueba de BPH en el protocolo de tamizaje, que incluye el automuestreo. Actualmente, la mortalidad por cáncer cervicuterino ocupa el segundo lugar como causa de muerte femenina. Somos conscientes de la necesidad de reforzar la capacitación y la educación en promoción y prevención de este cáncer, particularmente en los trabajadores de atención primaria, con miras a llegar a la población femenina del país. La mejora de la toma de citologías se relaciona a una mejora de los insumos y recursos humanos, por lo que los esfuerzos deberán dirigirse a una promoción para concientizar sobre el tema, con recurso humano competente y mantener una red de referencia para la confirmación diagnóstica y las intervenciones sean eficaces y rápidas. Somos el primer país de la región de las Américas en ofertar la vacunación contra el VPH de manera gratuita y forma parte del cuadro de vacunas a niñas y niños amparado bajo la ley que regula el proceso de vacunación de la República de Panamá. En el año 2008 se inicia con las niñas de 10 años, 11 meses y 29 días. Y en el 2016 se incluye a los niños de igual edad, cuya cobertura se ha incrementado en el tiempo. En general, se mantiene una cobertura de más del 50% de la población de responsabilidad, con aceptación en la vacunación de niños. Sin embargo, por efectos de la pandemia, bajó esta captación y esperando que en el 2022 y 2023 se incremente. Desde el Plan Estratégico Nacional para la Prevención y Control del Cáncer 2019-2029, en Panamá, la pandemia de COVID repercutió negativamente en la implementación de las estrategias de vacunación. No obstante, de manera progresiva el país continuará con el cumplimiento de este plan y asume la responsabilidad de educar y sensibilizar a la población mediante campañas informativas sobre la importancia de la vacunación en el grupo objetivo. Como país comprometido con su control, tenemos desafíos en los que priorizamos la ejecución de este plan de acción y los programas de prevención y control. Gracias.
Gracias, Panama. Dr. Hennis.
Thank you, Mr. President, and thank you so much to the member states who have made interventions, and all the member states who have continued to work assiduously on this implementation of this plan of action for cervical cancer prevention and control 2018 to 2030. Let me acknowledge Antigua, Canada, Suriname, Brazil, Paraguay, Cuba, Barbados, Honduras, and Panama. This report presents progress after almost 4 years of implementation of the plan of action. Although highly preventable, as we've heard, through HPV vaccination, screening and treatment, cervical cancer remains one of the leading cancers in women and responsible for an estimated 74,000 new cases and about 38,000 deaths in the Americas annually. PAHO has been providing technical cooperation on this public health matter for over 20 years. And the global strategy to eliminate cervical cancers raised political awareness of the potential to eliminate a cancer and also to eliminate a non-communicable disease. And not if, but when we achieve elimination of cervical cancer, this will be the first entity that the world will eliminate. There's been an increase in the number of countries and territories reporting a cervical cancer screening program, with 30 countries in 2021, up from 10 in 2017. But as noted, there have been no countries that have newly initiated a cancer registry. So there are tremendous gaps that need to be addressed in this regard, particularly regarding information. HPV vaccination is included in national immunization programs in almost all countries and territories. But as noted, the COVID-19 pandemic adversely affected vaccination strategies. And as such, now, there's been no progress in the indicator for improved HPV vaccine coverage. In 2019, half the countries in the region had reached approximately 50% HPV vaccination coverage for girls aged 9 to 14, but in 2020, only a quarter of the countries had achieved at least 50% of HPV vaccine coverage. So again, a lot of areas for concern. We have to recover this space. We have to scale up the effort. Screening for cervical cancer, notably using HPV testing as the recommended testing, has not progressed well. And I will acknowledge the efforts of Antigua to do so, and we work quite close in collaboration with them and the other member states that have actually instituted HPV testing. Nonetheless, in terms of the country context where perpendicular testing is appropriate and available, again, this needs to be scaled up. Budgets have been insufficient to procure the necessary HPV tests and supplies. But there's an opportunity to update cervical cancer guidelines based on the new WHO guidelines for screening and treatment, as well as to repurpose PCR testing platforms that have been available for COVID testing towards HPV testing. And this has been achieved successfully by some of the member states. So PAHO will continue to provide technical cooperation to member states. We also know the issue raised by Canada about equity. And again, this is quite an important context that must be taken on board in terms of the technical approach to cervical cancer screening and management. So we will continue to provide technical cooperation to ensure the targets set out in the regional plan of action are met by 2030 and to put countries on a pathway for future elimination. Thank you, Mr. President.
Thank you, Doctor. Madam Director.
Yes, after this splendid response from Dr. Hennis, I just want to take the opportunity to say how important that this is for women and girls and everybody who has a cervix, that this is given attention and really sufficient attention. And let me just remind you that this is included in the list of diseases and conditions to be eliminated. And I'm sure that saving 38,000 lives a year is very important for us, and certainly reducing the number of infections that are now standing at 74,000. So thank you for your continued interest, and let us step up this work. Thanks.
Thank you, Madam Director. As per all our items, these discussions will be reflected in the final report. Can I move to item 812B? Sub-item, sorry, 812B, Plan of Action for Women's, Children's, and Adolescents Health 2018-2030. Progress report, and ask Dr. Francisco Serpa to join us at the head table. And Executive Committee Rep, over to you.
Thank you, Mr. President. In the Executive Committee's consideration of the progress report, delegates supported the continued implementation of the plan of action, reaffirming their commitment to the health and rights of women, children, and adolescents. Support was also expressed for the actions proposed in the report to improve the situation in the region. Delegates welcomed the progress made thus far, but also called attention to challenges hindering the implementation of the plan of action in the region, including inequalities in access to health services, limitations in human and physical resources, restrictions on access to sexual and reproductive health services, including abortion, and long-standing challenges in the delivery of essential health services for lesbians, gay, bisexuals, trans, and other gender and sexually diverse populations. Delegates also highlighted the effect of the COVID-19 pandemic on the implementation of the plan of action, including disruptions in the delivery of health services and increases in maternal and neonatal deaths. It was considered critical to give the highest priority to essential health services that have been interrupted during the pandemic, including services to women, children, and adolescents. Thank you, Mr. President. That concludes my report on this item.
Many thanks. Could open the floor now to comments from delegates. Canada, followed by Argentina.
Thank you, Mr. President. Canada would like to take this opportunity to thank PAHO for this progress report on the Plan of Action for Women's, Children's and Adolescents' Health 2018 to 2030. Canada fully supports the actions proposed by PAHO in this Plan of Action and continues to encourage member states to invest in evidence-based interventions to improve the situation in the region. At the Executive Committee in June, Canada encouraged PAHO to take action in encouraging member states to prioritize essential services for two-spirit, lesbian, gay, bisexual, transgender, queer, intersex, and gender and sexually diverse people. We also urge PAHO to take action in encouraging member states to prioritize inclusion of Indigenous peoples in the strategic lines of action, many of whom continue to experience deeply rooted traumas due to colonialism, such as intergenerational trauma, overt and systemic racism and discrimination, and social and economic inequalities. Canada's commitment to a renewed nation-to-nation relationship with Indigenous peoples based on recognition of rights, respect, truth, cooperation, and partnership means making high-quality and culturally relevant healthcare free from discrimination a reality for Indigenous peoples. In Canada, this also means a focus on realizing substantive equality for Indigenous children, rectifying historic harms, and supporting Indigenous-led efforts to address the impacts of intergenerational trauma. Finally, we would like to reemphasize our support for the important work of our partners who are ensuring that quality and safe sexual and reproductive health services continue to be available and accessible to all. Canada stands ready to protect advocacy efforts that promote rights for all, and especially for women, Indigenous peoples, gender diverse people, and girls. Thank you.
Thank you, Canada. Argentina, then Cuba.
Gracias, señor presidente. La Argentina apoya la implementación del Plan de Acción en línea con los ODS, la Agenda de Salud Sostenible para las Américas y la Declaración de Astana. Nuestro país entiende que garantizar el cumplimiento efectivo de los derechos sexuales y reproductivos de las mujeres y otras personas gestantes es una prioridad a nivel nacional y regional. La Argentina ha ido incorporando las demandas y las luchas de la sociedad por la igualdad, la no discriminación, la erradicación de las violencias por motivos de género, asumiendo tales procesos sociales en sintonía con los marcos normativos internacionales y desde la creación de legislación nacional pionera en el reconocimiento de los derechos de las mujeres y personas LGTBI+. Entre las principales leyes nacionales podemos mencionar la ley que crea la Ley Nacional de Salud Sexual y Reprocreación Responsable, la Ley de Anticoncepción Quirúrgica, la Ley de Derechos de las Madres, Padres y las Personas recién nacidas durante el proceso de nacimiento o parto, la ley que crea el Programa Nacional de Educación Sexual Integral, la Ley de Identidad de Género, la creación del Plan Nacional de Prevención del Embarazo No Intencional en la Adolescencia, la ley que regula el acceso a la interrupción involuntaria del embarazo y a la atención del posparto, la Ley Nacional y Cuidado Integral de la Salud durante el embarazo y la primera infancia. Asimismo, recordamos que la garantía de los derechos humanos básicos se enmarca en los tratados internacionales y en los compromisos específicos para la protección de las mujeres, niñas, adolescentes y otras personas con capacidad de gestar con y sin discapacidad. Cumplir con las obligaciones asumidas en esta materia y proteger los derechos sexuales y reproductivos permitirá alcanzar mayores niveles de justicia social y desarrollo para los países y para la región. Además, contribuye de manera sustancial en la disminución de la morbimortalidad materna. Sin embargo, las restricciones legales, las inequidades en el acceso a los servicios, en la disponibilidad de recursos humanos y físicos adecuados y en la calidad de la atención sanitaria impactan de manera prominente en los sectores más vulnerables de la población. Por ello, la acción determinada del Estado es crucial para evitar retroceder y progresar en el cumplimiento de los compromisos asumidos. En este sentido, manifestamos nuestra preocupación por el hecho de que algunos países de la región puedan retroceder en la protección de los derechos humanos fundamentales, como es el derecho al acceso a los servicios de salud sexual y reproductiva, y alentamos a todos los países de la región de las Américas a continuar trabajando en pos de garantizar más derechos a las poblaciones más vulnerables. Asimismo, consideramos que se debe promover un diálogo regional sobre el acceso a los servicios de salud sexual y reproductiva, lo cual sugeriremos incluir en el punto del Comité Ejecutivo el viernes. Muchas gracias.
Gracias, Argentina. Cuba, then Honduras.
Gracias, señor presidente. Para Cuba, la atención a mujeres, niños, niñas y adolescentes constituye una prioridad. Las políticas sociales y sanitarias existentes lo respaldan. El país logró cumplir los principales objetivos de la Cumbre Mundial a favor de la infancia y se cumplió con anticipación la meta número 1 del Plan Nacional de Acción, que plantea mantener la tasa de mortalidad infantil por debajo de 8 por 1000 nacidos vivos. Desde el año 2000, nuestro país mantiene ese propósito por debajo de 8. Existen programas intersectoriales para la política de atención a la niñez, adolescencia y las juventudes. El programa de adelanto de la mujer y el programa de dinámica demográfica dan respuesta a las principales necesidades de atención de esta población. Además, desde el año 1980 en Cuba existe un programa de atención materno-infantil. Todos estos programas tienen sus indicadores y metas hasta el año 2030 con un monitoreo constante, yo diría diario. La promoción, protección y apoyo a la lactancia materna es la intervención más efectiva. Se ha revitalizado el programa de hospital y consultorio Amigo del Niño, la Niña y de la Madre, montado en una estrategia de educación y promoción de salud. Funcionan en el país de forma estable durante todo el año los 14 bancos de leche humana, logrando un mayor número de niñas y niños y familias beneficiadas con esta práctica. Durante la pandemia se mantuvieron los servicios de salud, incluyendo las consultas de puericultura, que fueron de 2.425.000. Luego de ensayos clínicos de rigor y la certificación de la Agencia Regulatoria Cubana, SECME, se inició la vacunación en edades pediátricas con vacunas cubanas contra la COVID-19 a todos los niños entre 2 a 18 años. Se alcanzaron coberturas de vacunación en la población pediátrica superiores al 95%. Se mantienen funcionando 143 hogares maternos, de ellos fueron habilitados como centro de atención a gestantes sospechosos y confirmadas de COVID, 5 de ellos, no produciéndose eventos institucionales. Y fueron revitalizados 28 hogares maternos más en el último periodo. Instamos a todos los Estados miembros a fortalecer las políticas que permitan una mejor atención al tema y se reduzcan las desigualdades que afectan a la salud de las mujeres, niños, niñas y adolescentes. Muchas gracias, señor presidente.
Gracias, Cuba. Honduras, and then Suriname.
Muchas gracias, señor presidente. Honduras está de acuerdo con el informe de progreso de Plan de Acción para la Salud de la Mujer, el Niño, la Niña y Adolescentes 2018-2030. Nuestras leyes, políticas, planes nacionales y normas están siendo alineadas a este plan de acción. Honduras retoma las recomendaciones para dar máxima prioridad a los servicios esenciales de salud para las mujeres, niños, niñas y adolescentes que fueron interrumpidos durante la emergencia por la COVID-19. Estamos trabajando en los sistemas de información destinados a la recopilación, el análisis y el uso de información estratégica desglosada por edad, ingresos, etnicidad y lugar de residencia a fin de mejorar el seguimiento de las desigualdades que afectan a la salud de las mujeres, niños, niñas y adolescentes, principalmente para los indicadores de salud sexual reproductiva. Estamos de acuerdo con la recomendación de dar prioridad a la aplicación de políticas intersectoriales y mecanismos de participación para mujeres y adolescentes con el propósito de abordar eficazmente las desigualdades persistentes. Es por ello que con el apoyo de la OPS, OMS, la Secretaría ha avanzado en estrategias para aumentar coberturas de planificación familiar con métodos modernos y de larga duración. Asimismo, se ha actualizado el Plan Nacional para la Reducción de la Mortalidad Materna. Se ha conformado el Comité Nacional de Vigilancia de Mortalidad Materna. Se ha actualizado los lineamientos para la vigilancia de la misma. Se ha elaborado el protocolo de atención a víctimas de violencia sexual y se han actualizado las normas de atención integral para adolescentes y su difusión. Se ha activado la red de hospitales para el registro, análisis y atención de mujeres en salud sexual y reproductiva en coordinación con el CLAP. Se ha conformado también la Comisión Nacional de Lactancia Materna. A nivel institucional, se ha conformado el programa de atención a las personas, familias y comunidades con un enfoque de curso de vida y se ha creado la Unidad de Género y Salud como un mecanismo de la mujer para poder incidir a lo interno de la Secretaría de Salud y fortalecer los vínculos intersectoriales a favor de la salud y empoderamiento de las mujeres, niñas y adolescentes hondureñas, para no dejar a nadie atrás. Muchas gracias, señor presidente.
Gracias, Honduras, Suriname, and then Brazil.
Thank you, Mr. President. This report is useful for Suriname as a reminder of the 4 strategic lines of actions with objectives and indicators of the plan of action that the country committed to work towards achieving in 2018. It also highlights the importance of programmatic monitoring and evaluation with routine data collection and analysis and the sharing of such information internally to improve program management and externally with PAHO to contribute to the regional data and analysis for the health trends. While some efforts were made in this regard, specifically the re-establishment of the Maternal and Newborn Steering Committee, the development of the National Maternal and Newborn Health Strategy 21-25, and Operational Plan 21-23, progress has been slow in the implementation of the strategy. The Maternal Mortality Review Committee should also be revitalized to conduct regular reviews and analysis of the maternal and perinatal deaths. The country is currently working with UN partners to develop a national adolescent health policy and strategy, and plans are in place to develop a child health strategy. The integrated and intersectorial approach to maternal, newborn, child, and adolescent health should ideally be implemented. The commitment to monitoring of programmatic indicators should also be strengthened as there is limited country data since 2017. Disaggregation of the data is also important to highlight the inequities and help to inform targeted interventions toward the most vulnerable groups. For example, those Amerindian of Afro descent living in the interior. In this regard, Suriname is strengthening its information system for health, including the implementation of the perinatal information system to help streamline the data collection and analysis for monitoring and decision-making. Commitment to international reporting on indicators related to this programmatic area should also be strengthened. The plan for the renewal of the health system in Suriname will contribute to strengthening the essential health services for women, children, and adolescents that were interrupted during the COVID-19 pandemic. The strengthened human resource capacity in the Family and Community Health Department of the Bureau of Public Health should also contribute to improving the health and well-being of women, children, and adolescents. We would like to thank the PAHO Suriname Country Office that is always available to provide technical assistance and is ready to engage with national counterparts as required. Thank you, Mr. President.
Thank you, Suriname, Brazil, and then Barbados.
Muito obrigada, presidente. E gostaríamos de agradecer o relatório de progresso apresentado. O Brasil vem caminhando efetivamente para atingir os objetivos do Plano de Ação da Mulher, da Criança e do Adolescente, em conformidade com a Estratégia Global para a Saúde das Mulheres, das Crianças e dos Adolescentes. Com a promulgação da Constituição Brasileira de 1988, o país assumiu a garantia do direito universal à saúde, tendo como consequência a criação do Sistema Único de Saúde e a instituição da proteção legal da criança e do adolescente, por meio do Estatuto da Criança e do Adolescente, ambos de 1990. No Brasil, nascem por ano aproximadamente 3 milhões de crianças em 4.705 maternidades, públicas e privadas. Como consequência, a promoção da saúde da criança e as estratégias de redução da mortalidade infantil vêm sendo eixos centrais nas políticas de saúde do Brasil nas últimas décadas. O Ministério da Saúde, como órgão formulador de políticas nacionais de saúde, tem fortalecido suas políticas e programas de atenção à saúde da mulher, da criança e do adolescente, fortalecendo as já existentes ou elaborando novas estratégias. São exemplos a Política Nacional de Atenção Integral à Saúde da Mulher, criada em 2004, que visa promover a qualificação da atenção integral à saúde da mulher, com foco que vai desde o planejamento familiar até o atendimento pós-parto, além do programa Força Pré-Natal, lançado em julho do ano passado, que tem como foco a redução da morbimortalidade materna e infantil por meio da qualificação à assistência recebida pela gestante. O Brasil vem avançando em políticas públicas de saúde que atuam em conformidade com o plano de ação proposto, no sentido de salvaguardar e promover a saúde das mulheres, das crianças e dos adolescentes. Muito obrigada.
Obrigado, Brazil. Barbados, please.
Thank you, Mr. President. The government of Barbados acknowledges the report and is committed to the implementation of the Plan of Action for Women's, Children's and Adolescents Health 2018 to 2030. During the post-pandemic recovery, it is crucial to give the highest priority to essential health services for women, children, and adolescents that were interrupted during the COVID-19 emergency. Member states are also urged to enhance efforts to strengthen information systems for the collection, analysis, and use of analysis and use of strategic information disaggregated by age, income, ethnicity, and place of residence in order to improve the monitoring of inequalities affecting the health of women, children, and adolescents. In addition, member states must prioritize the implementation of intersectoral policies and participation mechanisms for women and adolescents in order to effectively address persisting inequalities. Lastly, it is essential to make greater investments in evidence-based interventions in schools, families, and communities in order to enhance actions to support healthy life trajectories. The rebuilding of essential healthcare services, which have been negatively impacted by the COVID-19 pandemic, is a priority for Barbados, and all efforts will be made to regain, sustain, and surpass pre-COVID-19 achievements in women's, children, and adolescents' health. I thank you, Mr. President.
Thank you, Barbados. I have one intervention from a non-state actor. Movendi, you have the floor.
Muchas gracias, señor presidente. En nombre de Movendi International, felicitamos a la OPS por este informe y también manifestamos nuestra preocupación por la grave brecha en la mejora de la salud de las mujeres, las niñas, los niños y los adolescentes, que se refleja no solo en el informe, sino también en el trabajo general de la región. Los daños producidos por el alcohol afectan de manera desproporcionada a la niñez, a la juventud y a las mujeres. Pero a pesar de ello, estos daños siguen sin abordarse en el trabajo para promover su salud. Algunos datos importantes. Se estima que el 3.2% de las mujeres adultas en las Américas tienen un trastorno por consumo de alcohol. Y esta es la tasa más alta entre mujeres en el mundo. Entre el 51 y el 94% de las niñas y niños entre 13 y 15 años informan haber iniciado el consumo de alcohol antes de los 14 años. Y el inicio temprano del consumo de alcohol aumenta el riesgo de daño por alcohol durante la adolescencia y la edad adulta. El alcohol es el segundo factor de riesgo más importante en la carga de morbilidad en el grupo de 10 a 24 años. Y aún más alarmante, el alcohol es el mayor factor de riesgo de carga de enfermedad en el grupo de 25 a 49 años. Así que el alcohol es un obstáculo para lograr la buena salud y el bienestar de las mujeres, las niñas, los niños y los adolescentes en las Américas. Y recordemos que existen soluciones de políticas de alcohol probadas y altamente costo efectivas para proteger mejor a los más vulnerables del daño causado por el alcohol. Estos son aumentar los impuestos al alcohol, introducir límites sensatos a la disponibilidad del alcohol y prohibir la publicidad del alcohol. Esto incluye patrocinio y promoción de bebidas alcohólicas. Hacemos un llamado a los Estados miembros y a la OPS a abordar adecuadamente la política de alcohol como catalizador para mejorar la salud de las mujeres, niñas, niños y adolescentes, y a implementar el paquete técnico SAFER para promover la salud y proteger mejor a las personas y comunidades más vulnerables y desproporcionadamente afectadas por los daños causados por el alcohol. Es hora de desbloquear el potencial de acción de la política sobre alcohol para promover la salud y el desarrollo para todas y todos. Muchas gracias.
Gracias. Dr. Francisco Serpa, any comments?
Thank you very much, Mr. President, Madam Director, colleagues. Thank you very much to delegations of Canada, Argentina, Cuba, Honduras, Suriname, Brazil, and Barbados for their comments on this topic. When during the discussions that led to the plan of action to be adopted by member states, I think we all knew that it was a very wide-ranging area to be worked upon. And perhaps that platform of working on the health of women, children, and adolescents actually became a very powerful platform for what we are talking about, how not to leave anybody behind. And this is important because this is avoiding the fragmentations from different vertical programs for the child health, for newborn health, for maternal health, and for adolescent health. And not only that, but it does provide the platform to reduce inequities in different groups of the population, gender, age, ethnicity, among others, and also brings together subgroups of the population, such as the LGBTQI population and others. So this non-fragmentation element, I think, is what member states are actually reflecting right now in terms of the progress that has been done in the different areas of that particular platform. And we see that in this first report, 2022, of a program that goes up to 2030. And I think COVID-19 has actually shown the power of such a platform in which all of the different policies are being contributed towards. One point specifically on alcohol that was actually recent. PAHO does have a very strong technical program on alcohol and recommendations, and this is something that has been certainly an important element within this platform, as well as with other psychoactive activities, substances that were discussed yesterday. Yo quisiera agradecer a los gobiernos que están participando por el trabajo que han hecho en términos de políticas de Estado para proteger la salud de las mujeres, niños y adolescentes dentro de la plataforma que estaba hablando, trabajando con diferentes sectores, trabajando con educación, trabajando con desarrollo, trabajando con promoción, porque estos son elementos que pueden potencializar a no dejar a nadie atrás, no solamente sobrevivir, pero también transformar y desarrollar. Entonces, el compromiso que ustedes están demostrando con todas las acciones que acaban de referirse es esencial. Y nosotros estamos aquí en el secretariado ofreciendo para algunas de las áreas en las cuales no se ha hecho progreso, actividades específicas para continuar hacia adelante con esta agenda tan importante para el 2030. Creo que eso sería todo de mi parte. Muchas gracias.
Thank you. Gracias, Madam Director. Any comments? No comments? Thank you all. Discussions will be reflected in the final report. We can move to item 8.12, sub-item C, Plan of Action for Strengthening Information Systems for Health 2019-2023 Progress Report. Asking Dr. Sebastián García Saiso to join us at the table. Executive Committee Representative, you have the floor.
Thank you, Mr. President. In the Executive Committee's discussions of the progress report, delegates reaffirmed their commitment to strengthening information systems for health, with several delegates highlighting the pivotal role of the COVID-19 pandemic and bringing to light the importance of digital tools in the response to health emergencies, accelerating the global development and implementation of such tools, and underscoring the importance of investing in public health data infrastructure and enhancing information sharing practices. It was stressed that innovations in health information systems should serve to enhance the accessibility, efficiency, and effectiveness of health services and to generate evidence for use in public health decision-making and policy development. The importance of digital health governance mechanisms was emphasized, as was the need to strengthen cybersecurity in order to protect health information systems. Thank you, Mr. President. That concludes my report on this item.
Many thanks. Again, to any delegations for comments? I'd like to encourage delegations. We're trying to get through this agenda this morning, so I know you have 3 minutes, but if you're able to finish your remarks in less than 3 minutes, I'd be grateful. So Brazil, followed by Suriname.
I'll do my best, Mr. President. Thank you. Gostaríamos de agradecer o relatório de progresso apresentado pelo secretariado, destacar sua pertinência em um momento em que a tecnologia vem se mostrando, sem dúvida alguma, como uma das melhores estratégias para se avançar rumo à democratização do acesso à saúde. Os avanços na prática do uso de ferramentas digitais interoperáveis, no desenvolvimento e adoção de sistemas no registro clínico e na disponibilidade de infraestrutura, contribuíram para uma melhor cultura do uso de dados e, portanto, na melhoria da qualidade desses sistemas. No Brasil, registramos progressos importantes em todas as linhas de ações estratégicas propostas pelo presente plano de ação, com destaque para a criação da Estratégia Nacional de Saúde Digital 2020-2028. A referida estratégia contempla 7 pilares de atuação, tendo o cidadão como centro de todo o processo. Desenvolvemos, ademais, a Rede Nacional de Dados em Saúde, RNDS, um repositório nacional de dados de Covid-19, que integrou ações de recebimento, processamento, disponibilização de notificações de agravos, resultados de exames e ocupação de leitos por coronavírus. Destacamos também o investimento que o Brasil vem fazendo em novos modelos de serviços e de oferta de informação de qualidade, por meio de governança cada vez mais colaborativa e inclusiva, de modo que a saúde digital no Brasil amplie seu alcance e integre cidadãos, profissionais, gestores e organizações dos serviços públicos e privados de saúde com segurança, confiabilidade em benefício de todos. Acreditamos que os componentes que dispõem sobre a saúde digital, bem como o uso estratégico de tecnologias na assistência em saúde, devem garantir ações voltadas para o desenvolvimento sustentável, de forma a reduzir desigualdades, assegurar uma vida saudável e promover o bem-estar de toda a população. Muito obrigada.
Obrigado, Brasil. Suriname and Honduras.
Thank you, Mr. President. Suriname thanks the Secretariat for this progress report. Suriname is currently implementing several AIDS4H initiatives, including the introduction of standardized electronic health records and health databases, such as the Perinatal Information System and the HIS2. It is hoped that With these initiatives, Suriname will be able to improve timely access to quality information to inform programmatic and decision-making processes. The National Health Sector Reform Plan and the Health Policy Plan also prioritize IH4H. We have installed the IH4H multi-sectoral steering committee, which has been functioning well and will support a governance mechanism to further advance progress in this area. Healthcare Israel has done an assessment to make health information exchange possible in Suriname. Now the IH4H steering committee is reviewing the report to develop a plan of action for health information exchange. The list of electronic health record requirements are being updated to be implemented by December 24 through the overall health system of Suriname. Suriname is now member of Rexel network chaired by Colombia and has a voice and the opportunity to get access to digital health networking, exchange of expertise, and lesson learned. We recommend that also other member states join this network. Suriname is also engaged in telehealth projects which aims to implement telehealth facilities for the hinterlands. National legislation regarding privacy and cybersecurity needs to be adapted for the implementation of information system for health. There is a need for technical support and guidance from PAHO. We request member states to share their lessons learned during their implementation process of IH4H. Suriname takes note of this progress report and will continue to implement IH4H initiative, noting the actions that are needed for improvement and for digital transformation of the health sector. Thank you, Mr. President.
Thank you, Suriname. Honduras, then Jamaica.
Muchas gracias, señor presidente. Honduras está de acuerdo con el informe de progreso de Plan de Acción para el Fortalecimiento de los Sistemas de Información para la Salud 2019-2023. Este Plan de Acción sigue siendo una gran oportunidad para que Honduras pueda elaborar el Plan Estratégico Nacional de Sistemas de Información Integrado de Salud de Honduras, que tanta falta nos hace. Con el apoyo técnico de la OPS-OMS, consideramos retomar nuestro plan de 4 líneas de acción propuestas. Inciso A, gestión y gobernanza de los sistemas de información. Inciso B, gestión de datos y tecnologías de la información. Inciso C, información y gestión del conocimiento. Inciso D, innovación, integración y convergencia. Este plan será establecido y desarrollado por la Unidad de Gestión de la Información de la Secretaría de Salud y es considerado un objetivo prioritario de la nueva Administración de Salud. Además, la línea de acción, gestión y gobernanza de los sistemas de información será una línea de acción prioritaria para responder a la fragmentación y no articulación del sistema actual y darle fuerza a la sostenibilidad, a la integralidad del plan. Muchas gracias, señor presidente.
Gracias, Honduras. Jamaica, then Cuba.
Thank you. Jamaica notes the progress report on the PAHO Plan of Action for Strengthening Information Systems for Health 2019-2023. In this regard, we recognize the sterling and consistent support of PAHO to Jamaica, commencing with the high-level meeting for the Caribbean sub-region, which was convened in Kingston, Jamaica in November 2016. Within the next 6 years, Jamaica has made progress as follows. Strategic Line of Action 1, the Strategic IS4H Plan of Action 2017-2021 has seen completion or significant progress with 83% of the major activities. The IS4H Strategic Plan 2022-2027 is being implemented with some key activities supported primarily by an IDB investment loan. The draft digital health policy addresses the electronic health records, the electronic prescription, telehealth, and the national IS4H policy and guidelines. The PAHO maturity assessment tool was applied in 2018 and used to identify and address priority gaps. The regulatory framework for data protection is provided by the Jamaica Data Protection Act 2020, and an interinstitutional committee for IS4H has been functional since May 2019. With respect to strategic line of action 2, Jamaica has introduced standards to facilitate interoperability, including specific ISO standards, FHIR, and Open EHR. The procurement of a national EHR system is advanced and will be supported by a national unique identifier for health-driven by identifying management policy to support the EHR as well as other electronic health systems. With respect to strategic line of action 3, Mr. President, this area is not yet significantly addressed in Jamaica due to focus on investments in data governance and management and strategic information for action. Strategic line of action 4, Jamaica recently acquired an affiliate license for SNOMED in recognition of its key role as a clinical terminology for the electronic systems. We acknowledge the International Classification of Diseases system, which primarily provides classification of health data for statistical purposes. The investment in the shared health records open platform will facilitate coordination, clinical care, patients' access to their own data, and real-time reporting and analytics. The lessons learned are relevant, particularly regarding the focus firstly on information management and governance, interoperability between systems, an open approach to data models, open data, and data protection. In closing, Jamaica supports the need to continuously strengthen governance mechanisms. However, we also recognize the need to establish a sustainable program that can drive the vision and mission for IS4H and provide strategic direction and management. In this regard, the powerful principles of digital transformation for public health have provided invaluable guidance. I thank you.
Cuba, please.
Gracias, señor presidente. Agradecemos los elementos aportados sobre el avance en las 4 líneas estratégicas que recoge el documento y los resultados alcanzados durante el periodo. En Cuba existe un marco legislativo relacionado con los principios de organización y funcionamiento del sistema de información del gobierno. En el mismo se integran los sistemas que se organizan para satisfacer las necesidades informativas en todos los niveles de la sociedad y el ciudadano, en los ámbitos económico, social, demográfico, geográfico, medioambiental, de funcionamiento de los órganos y en otros que se decida como parte de la política para la toma de decisiones y el diseño y seguimiento de políticas públicas que aseguran el desarrollo económico y social del país. El subsistema de información de estadísticas complementario de salud forma parte de este sistema, lo cual constituye una fortaleza para la gestión y gobernanza de los sistemas informáticos para la salud. La aplicación de herramientas digitales para la gestión económica, epidemiológica, en el proceso y uso inmediato de datos continuos y veraces durante la COVID-19 constituyó una de las principales fortalezas en la gestión de datos y el uso de las tecnologías de la información. Asimismo, en Cuba en los últimos años se avanzó en programas de robótica médica, medicina de precisión, nanociencia y neurociencia, entre otros, los que exigen procesar y asimilar grandes volúmenes de datos. La producción de sistemas de información que humanizan el trabajo en los departamentos de registros médicos y estadísticas de salud. El diseño de sistemas de información sobre plataformas web que permitan la obtención de información para la toma de decisiones en salud oportuna, lo consideramos de suma importancia. Cuba forma técnicos y licenciados en sistemas de informatización en salud desde el propio sector como organismo formador. Constituye esto una fortaleza en la integración para la información y la gestión del conocimiento de salud. Cuba es miembro de varias redes subregionales de intercambio de conocimiento sobre innovaciones tecnológicas, como la Red para el Fortalecimiento de los Sistemas de Información para la Salud. Consideramos que debemos continuar avanzando e integrarnos como región en estos temas para tener progresos más significativos. Muchas gracias, señor presidente.
Gracias, Cuba. Last speaker, Bolivia.
Buenos días, señor presidente. Muchísimas gracias por la información brindada. Los cambios tecnológicos producidos en el mundo, en la región, principalmente en temas vinculados a telecomunicaciones e Internet, son innegables. El Estado Plurinacional de Bolivia ha impulsado el aprovechamiento de las nuevas tecnologías de información y comunicación en relación al uso de gobierno electrónico enfocado en la sociedad civil. En este contexto, el nuevo sistema de información en salud está incorporando herramientas de gobierno electrónico y en este contexto debe presentarse como una oportunidad para favorecer y mejorar las condiciones de desarrollo de gobierno electrónico. En el Estado Plurinacional de Bolivia, conforme lo instituye la Ley 1152, el Sistema Único de Información en Salud centralizará e integrará la información de todas las instituciones del sector de salud en todos sus niveles de atención y gestión, y será administrada exclusivamente por el Ministerio de Salud y Deportes. En este contexto, el diseño del Sistema Único de Información en Salud abarcará el subsector público, el subsector de la seguridad social a corto plazo y el subsector privado. Es importante recalcar que todos los esfuerzos que se están haciendo desde la región para incorporar el uso de las tecnologías de información y comunicación deben ser plena y conformemente apoyadas a partir de la OPS. Muchísimas gracias.
Gracias, Olivia, and thank you all for your brief comments, and I will extend the same request to Mr. Director for any comments you'd like to make.
Thank you, Mr. President, Madam Director, delegates, colleagues. Allow me to switch to Spanish to be brief and fast in my comments. Quiero agradecer de entrada todos los comentarios realizados por los Estados miembros. Sobre todo quiero agradecer el apoyo a esta iniciativa. Y es algo que vemos no solo en sus comentarios, sino en muchas de las intervenciones en otras iniciativas que se han presentado durante esta conferencia. Hemos señalado la importancia de contar con más y mejores datos en cada una de estas propuestas que se han analizado hacia el futuro y por supuesto también en los informes de progreso que se han presentado. Resaltando también esto, el valor que tenemos en estos datos que necesitamos generar para contar con información desagregada para medir realmente las brechas que persisten en salud, el poder trabajar sobre las grandes inequidades que persisten en nuestra región y así poder también avanzar juntos hacia el futuro. Quiero destacar en particular el liderazgo de los países del Caribe. Y se hacía mención justamente a esta reunión en 2016 en Kingston, Jamaica, en donde dio inicio esta iniciativa. Y desde el Caribe, entonces se pudo avanzar hacia toda una región y en 2019 convertirlo en un plan de acción que nos une a todos. Durante este periodo hemos visto cómo los Estados miembros no solo han podido incorporar la iniciativa IS4H a sus acciones y planes nacionales de salud, sino también a estructuras operacionales dentro de las instituciones de salud. Hoy vemos con enorme satisfacción a países que están generando direcciones nacionales de sistemas de información, planes nacionales de sistemas de información para la salud, hojas de ruta, entre otras muy importantes intervenciones prioritarias que nos permiten avanzar como región en esta dirección. Desde que se aprobó la iniciativa en 2019, los países y los territorios de nuestra región han avanzado considerablemente en temas de gestión y gobernanza de sistemas de información, en la administración de los datos y soluciones digitales, en la gestión de la información y el conocimiento para la salud, así también como en temas de innovación. Y durante el periodo también logramos en conjunto en la región realizar el análisis del nivel de madurez de los sistemas de información en los países y territorios. Esto es algo que nos ha permitido desde estos resultados trazar las hojas de ruta para las intervenciones y de la mano además con socios estratégicos en el entorno regional como ha sido el Banco Interamericano de Desarrollo y otros que justamente están avanzando con ustedes en la implementación de estos planes y en la construcción de las rutas hacia el futuro. No hay duda también que la pandemia por COVID-19 ha acelerado importantemente la adopción de tecnologías de Información y Comunicaciones, y esto también se ha señalado el día de hoy, y que esto te ha posicionado, el fortalecimiento de los sistemas de información se ha posicionado como uno de los factores críticos para el éxito de cualquier programa de salud, principalmente en la atención de las emergencias sanitarias, pero también como un elemento prioritario en la construcción de sistemas de salud resilientes. Y como ocurre en muchas otras áreas nuevas o emergentes dentro de la salud pública, por supuesto, necesitamos hacia adelante también avanzar en el entendimiento, en la comprensión de conceptos claves, como lo es la interoperabilidad, la alfabetización digital, la inteligencia artificial, el Internet de las cosas, entre otros elementos que están surgiendo y avanzando rápidamente y que sin duda tendrán implicaciones en la arquitectura de los sistemas de salud y en la salud pública como un todo. Y necesitamos con esto repensar nuestros modelos de atención, entendiendo el potencial de la salud digital, modernizar nuestros instrumentos normativos y legales, también facilitar acceso a datos críticos en tiempo y formato necesario y sobre todo ajustar políticas públicas para que los avances alcanzados hasta ahora sean realmente sostenibles hacia el futuro. No quiero extenderme más, pero quiero hacer un reconocimiento muy importante a la doctora Caricetiana, nuestra directora, por esta visión en 2016, ya que fue ella quien dijo, necesitamos atender este tema en el más alto nivel. Necesitamos generar una discusión del más alto nivel y eso dio origen precisamente al establecimiento de todas estas acciones. Muchas gracias a todos y seguiremos sin duda apoyando con cooperación técnica para avanzar en este plan de acción. Muchas gracias.
Gracias. And visionary Madam Director.
Señor Presidente, I merely want to say thank you to member states. From 2013, I'd been hearing the complaints about strengthening information systems. I created the Department of Evidence and Information for Health for that very reason and allocated resources for strength. And what I'm hearing is that we are seeing movements. We have a tool, a maturity tool that IDB is using on the basis of which they are allocating loans to member states. So we are on the move. We have to do digital transformation. We need to do digitalizing. But all of this is to better the systems for our people. So thank you very much for responding, because I was only responding to your request and your pleading. Thank you that we can do it together.
Thank you, Madam Director. Mr. Director-elect, wherever you are, hope you're paying attention. I can inform the conference discussions will be reflected in the final report. Let's move now to item 8.12, sub-item D, Plan of Action for the Elimination of Industrially Produced Trans Fatty Acids, 2020-2025 midterm review. And then ask Dr. Hennis to return to the table and over to our executive committee colleague.
Thank you, Mr. President. And the Executive Committee's discussions of the midterm review, delegates reaffirmed their commitment to the elimination of industrially produced trans fatty acids and express support for the actions recommended in the progress report to improve the situation. Delegates also highlighted the link between consumption of industrially produced trans fatty acid and chronic non-communicable diseases, underscoring the need to promote healthy eating habits. The importance of information campaigns to educate the public about the risks associated with consumption of trans fatty acid was highlighted, as well as the need for warning labels with clear information on the trans fat content of foods. Delegates also underscored the crucial importance of legal and regulatory measures to regulate the use of industrially produced trans fatty acids in food productions. It was considered essential to work with the food industry with a view to eliminating partially hydrogenated oils from the food supply. Thank you, Mr. President. This concludes my report on this item.
Many thanks. Again, open the floor to delegates for any comments. Brazil, and then Jamaica.
Obrigada, senhor presidente. O Brasil está fortemente empenhado no processo para a eliminação de gordura trans de produção industrial nos alimentos, conforme o plano de ação proposto para o período 2020-2025. Evidências científicas demonstram os prejuízos causados à saúde pelo consumo de gorduras trans de origem industrial. Seu consumo contribui diretamente para o desenvolvimento de inflamação vascular e desenvolvimento de doenças cardio- e cerebrovasculares. Dessa forma, no Brasil, a partir da coordenação da Anvisa, Agência Nacional de Vigilância Sanitária, foi aprovada a resolução que dispõe sobre a restrição do uso de gorduras transindustriais em alimentos. A quantidade de gordura transindustriais nos óleos refinados não poderão exercer 2 gramas por 100 gramas de gordura total. A partir do dia 1º de janeiro de 2023, ficam proibidos a produção, a importação, o uso e a oferta de óleos e gorduras parcialmente hidrogenados para uso em alimentos e de alimentos formulados com ácidos graxos trans. O Ministério da Saúde do Brasil tem fortalecido suas políticas e programas de segurança alimentar e nutricional, estabelecendo diretrizes claras de promoção de práticas alimentares saudáveis para atender a dupla carga de doença, ou seja, a persistência da desnutrição e carências nutricionais e a alta incidência de doenças crônicas não transmissíveis que ainda persistem em nosso país e na região. No intuito de ambicionar pela completa eliminação dos ácidos graxos e sua substituição por óleos e gorduras saudáveis, colocamos-nos à disposição para trocar experiências e práticas exitosas com os países da região. Obrigada.
Obrigado, Brazil, Jamaica, then Cuba.
Thank you, Mr. President. Jamaica thanks the PAHO for this comprehensive progress report. Jamaica has made progress in the implementation of the plan of action for the elimination of industrially produced trans fatty acids. Significant work needs to be done to eliminate partially hydrogenated oils from the food supply and or to limit industrial produced TFAs content to no more than 2% of the total fat in all food products. Under Strategic Action 1, Jamaica has initiated work towards the enactment of regulatory policies. A consultation was conducted in June this year with key stakeholders, including representatives from the food industry, to discuss the assessment of industrially produced trans fatty acids in Jamaica, share best practices, and discuss policy options for the elimination of trans fatty acids. The manufacturing group in September 2022 meeting expressed a willingness to work with the government towards the elimination of trans fat by 2025. To this end, a group is being constituted to develop the plan of action for the elimination of trans fatty acids. A process which the manufacturing group committed to. An expert-led workshop is also being organized for October 2022 to provide training to support this work. Under Strategic Action 2, Jamaica has not yet established or enacted policies for this. However, we are increasing our capacity at labs. Under Strategic Action 3, Jamaica conducted a national pre-regulatory assessment of the food. This study was shared with key stakeholders. Under Strategic Action 4, Jamaica has implemented education and communication strategies on the negative health impacts of TFAs and benefits of the elimination policies. Between 2021 and 2022, consultation with key stakeholders were held, including academia, food industry, media, and the general public. The reduction of risk factors for NCDs remain a priority for Jamaica. We are committed to implementing the 4 strategic lines of action and thanks PAHO for the technical support in this area. Thank you.
Thank you, Jamaica. Cuba.
Gracias, señor presidente. Este plan de acción que propone eliminar estas sustancias nocivas mediante la plena adopción y ejecución de políticas para eliminar ácidos grasos trans de producción industrial en toda la región de las Américas. Cuba, en concordancia, ha promulgado políticas regulatorias como el Decreto Ley número 9 de inocuidad alimentaria, que tiene como objetivo establecer las regulaciones y los principios que garantizan a lo largo de la cadena alimentaria, con un enfoque educativo, preventivo e integral, alimentos inocuos y nutritivos que proveen una adecuada protección de la salud, así como lograr un desarrollo competitivo y responsable de las entidades involucradas, con el fin de lograr la transparencia y participación que asegure la confianza de los consumidores. Se adoptó en Cuba también la Ley de Soberanía Alimentaria y Seguridad Alimentaria y Nutricional, la que establece el marco jurídico general para alcanzar la soberanía alimentaria, así como fortalecer la seguridad alimentaria y nutricional en función de la protección del derecho de toda persona a una alimentación sana y adecuada. Ambas acciones están en correspondencia a la promulgación de políticas regulatorias. Consideramos se debe continuar monitoreando este tema y estimular la divulgación de los avances alcanzados por los países de la región. Muchas gracias, señor presidente.
Gracias, Cuba, and finally Barbados.
Mr. President, colleague ministers, excellencies, delegates, distinguished ladies and gentlemen. Let me begin by thanking the Director General for the midterm review of Plan of Action for Elimination of Industrially Produced Trans Fatty Acids 2020 to 2025. Barbados is grateful for the support of PAHO, WHO, and CARICOM regional efforts to reduce the burden of IPTFAs. There is much to be done to advance the elimination of trans fats from the regional and local food supplies. We're also happy to have been able to be part of the efforts in CARICOM through our participation in Intergovernmental Working Group on Unhealthy Diets and Obesogenic Foods, Environments, and co-chairing of the 6th Joint COTED-COSOD meeting by the Minister of Health and Wellness of Barbados. We are awaiting Cabinet's review of a policy paper, which calls for an IPTFAs policy by December 31, 2023. This paper has supporting comments from the relevant ministries and departments, including Foreign Affairs and Foreign Trade and the Ministry of Innovation, Science and Technology. We look forward to continued support from PAHO and the regional and local efforts to protect the food supply and support the attainment of the highest level of health possible by our population. Barbados notes the report and encourages all members to continue to work towards the attainment of an improved country capacity for the sustained implementation. CARICOM has a golden opportunity to ensure that the region is TFA-free by 2024. Mr. President, thank you.
Thank you, Barbados. I have one non-state actor intervention, the International Federation of Medical Students Associations. You have the floor.
Thank you, Mr. President. Distinguished delegates, the International Federation of Medical Students Associations would like to congratulate the progress presented in the midterm review against the high mortality products such as trans fatty acids. Now more than ever, it is necessary to take a strong position to reduce non-communicable diseases. We urge the member states to increase their efforts not only to approve policies directed towards achieving the goal of the 4 strategic lines established in the Plan of Action, but to assure their implementation and publish updated and trustworthy data of their work. In addition, we make a call to action to establish mechanisms that ensure a comprehensive collaboration across sectors, including civil society organizations and the youth. Thank you.
Thank you, and thank all delegations for keeping their comments brief. Mr. Director, brief comments from you.
Thank you, Mr. President. Madam Director, member states, I acknowledge the contributions by Brazil, Jamaica, Cuba, Barbados, as well as the International Federation of Medical Students, and of course, to all member states who continue to work on this plan of action for elimination of industrially produced trans fatty acids 2020-2025. As we know, there's no health value, and in fact, there's harm from industrially produced trans fatty acids. Of the 500,000 deaths that occur globally every year, 160,000 of these deaths occur in the region of the Americas. Now, more countries have enacted or started implementing the PAHO WHO best practice policies for the elimination of industrially produced trans fatty acids. So there's been a 63% increase in the proportion of the population in this region now protected from consuming this harmful substance in 2021 compared to the baseline. We acknowledge the work done by Brazil and congratulate them in that they are going to enact policies to eliminate the use of IPTFA, industrially produced trans fatty acid content, to less than 2% of total fat in all food products effective January 2023. This is what we need to achieve in every member state. We also note that while progress regarding countries and territories prohibiting the production, importation, distribution, sale, and use of partially hydrogenated oils or IP trans fatty acids in excess of 2% has been slow, there has been progress regarding countries and territories requiring standardized labeling of partially hydrogenated oils and ingredient lists. So this target has been achieved, but we've had less success regarding the use of front of package labeling. There's been little progress regarding countries adopting effective implementation and enforcement policies. And I'll acknowledge too that we work closely with the Office of the Legal Counsel of PAHO in these areas where we need to strengthen countries' technical capacity in terms of legislation and policies. So thank you, I acknowledge and thank the Office of the Legal Counsel. Member states have done better regarding national evaluation of foods containing industrially produced trans fatty acids pre and post regulation, with progress achieved in Strategic Line of Action 3. However, a lot of work is needed by member states to create awareness of the harmful effects of industrially produced trans fatty acids and the benefits of elimination. And I thank Jamaica for its contribution to this discussion this morning. So thank you to all, and we continue to work with you to eliminate these harmful substances from human consumption. Thank you, Mr. President.
Thanks, Madam Director. Any comments? Madam Director, I think I recall the Executive Committee of 2019, where I was president, that this was the time that the plan of action was first adopted. And if I recall correctly, I think I said at the time that we should mark this moment because it's the beginning of PAHO outlawing potato chips. And I'm just speaking for my country, although it's impossible to outlaw potato chips, we are seeing a lot more healthy options in the potato chip aisle. So at least we can say there's some progress being made. So I'd like to inform the conference discussions will be reflected in the final report. And I'd like to move to item 8.12, sub item E. And we'll complete this item and then take a short break. Access and rational use of strategic and high-cost medicines and other health technologies, progress report. Ask James Fitzgerald to join us again, and again to the Executive Committee representative to report.
Thank you, Mr. President. In the Executive Committee's discussions of the progress report, delegates reaffirmed their continued support for the policy on access and rational use of strategic and high-cost medicines and other health technologies, and endorse the actions proposed in the progress report to improve the situation. Delegates emphasized the importance of promoting technology transfer and local production in order to achieve self-sufficiency and thereby facilitate access to medicine and other health technologies in the region. It was also considered essential to promote market transparency and fair pricing. The need for restraint in the prescription and use of antibiotic to ensure their optimal use and avoid antimicrobial resistance was highlighted. Thank you, Mr. President. That concludes my report on this item.
Many thanks. Open the floor. I'll recognize Panama.
Muchas gracias, señor presidente. Panamá apoya el informe sobre acceso y uso racional de medicamentos y otras tecnologías sanitarias y de alto costo. En este momento, nuestro país se encuentra en una transformación, una transición regulatoria, tecnológica y política para disminuir el costo y mejorar el acceso de medicamentos esenciales. En el tema regulatorio hemos propuesto 10 decretos y leyes, y en este momento en la Asamblea de Diputados se está discutiendo la ley de medicamentos para Panamá, la nueva. En el tema tecnológico se desarrolló un app, Medic App, para que toda la ciudadanía tenga acceso de manera geolocalizada a las farmacias con sus medicamentos y los precios, para poder generar una competencia sana entre la industria. Y también estamos sentados en la mesa con Fede Pharma, que es la que aglutina a todas las farmacéuticas de investigación en el país, para poder discutir con ellos la disminución de los precios, porque no puede ser que Panamá lo midan con una vara diferente diciendo que el Producto Interno Bruto, y que cuando vamos a la realidad no es justo medir a los países solo con el Producto Interno Bruto cuando tenemos similitudes en ambos lados en nuestros países vecinos, como por ejemplo Colombia, donde los precios son mucho más baratos que Panamá, y tenemos la misma temperatura, porque hablan de región 4 por la temperatura, pero tenemos temperaturas similares en los países vecinos. Nosotros sabemos que en el sur, tanto Chile como Argentina han avanzado mucho en sus programas, y si solicitamos entonces el apoyo de estos países y de la OPS, que nos hagan el acompañamiento en este proceso que tenemos en este momento, que no es fácil. Hemos implementado una medida de 6 meses de disminución del 30% en todos los medicamentos a nivel nacional, pero esto no es sostenible en el tiempo. Así que estos 6 meses nos están dando el tiempo para poder hacer esta negociación. Ya estamos adscritos a un OPS con el observatorio, y tenemos toda una hoja de ruta para poder disminuir y transformar esto. Y esto no solo pasa por los precios, pasa también porque los médicos receten los genéricos como debe ser y no se vayan solamente a medicamentos de marca. Entonces, estamos impulsando un hub farmacéutico también con incentivos fiscales para que vengan las industrias a establecerse en Panamá, y apoyar también nuestro mercado nacional de farmacéuticas con mejoras en el ingreso de sus materias primas. Entonces, estamos en esta transición, en esta transformación, y solicitamos el apoyo y el acompañamiento de OPS y de algunos países amigos del sur que han avanzado en este tema. Muchas gracias.
Gracias. Panama, Argentina, and then Suriname.
Gracias, señor presidente. La Argentina toma nota del informe de progreso sobre la ejecución de esta política. Nuestro país sostiene en diversos foros regionales y globales la premisa de que para superar las dificultades en la transferencia de tecnología y evitar las barreras en el acceso a las vacunas, en especial en los países en desarrollo, es indispensable diseñar e implementar compromisos y acciones que promuevan la producción local de medicamentos, tratamientos, vacunas y otras tecnologías sanitarias. En este sentido, apoyamos las iniciativas existentes, incluyendo la resolución sobre el aumento de la capacidad de producción de medicamentos y tecnologías sanitarias esenciales. Además, como indica el documento, la Argentina ha coorganizado, junto con la OPS y la OMS, el tercer foro sobre fijación de precios justos, en la que se destacó el tema de la transparencia de los mercados y los costos de la cadena de suministros como un desafío regional y mundial. Asimismo, nuestro país ha apoyado la extensión de la estrategia global y plan de acción de la OMS sobre salud pública, innovación y propiedad intelectual hasta 2030. Con respecto a la iniciativa CITAP, continuamos manifestando nuestro apoyo y alentamos a otros actores a apoyar esta iniciativa y compartir sus licencias de forma transparente y no exclusiva a través de este mecanismo. Y en relación a lo solicitado recién por la delegada del Panamá, por favor cuenten con el apoyo y la experiencia argentina para fortalecer la política de medicamentos en cualquier país de nuestra región. Gracias.
Gracias, Argentina, Suriname, then Honduras.
Thank you, Mr. President. Access to strategic high-cost medicines and other technologies continues to be a challenge for the health system in Suriname due to cost and the relatively low quantities needed, among other things. Policies and procedures that support the accurate demand forecasting, procurement, ongoing monitoring, evaluation, and the rational use of medicines and other health technologies are in need of strengthening. The improved use of the PAHO Strategic Fund will assist in ensure high-quality medicines and health technologies, even with low quantities required by Suriname. Putting in place a strong regulatory system for the incorporation, evaluation, and rational use of MHGs is also a priority of the Ministry of Health Suriname, and the re-establishment of the National Regulatory Committee will help to advance progress in this area. Suriname takes note of this report and will continue its efforts to implement the policy and to work with PAHO and other stakeholders to identify areas of possible collaboration and support to strengthen access and regional use of strategic high-cost medicines and other technologies. Thank you, Mr. President.
Thank you, Suriname. Honduras, then Brazil.
Muchas gracias, señor presidente. Honduras está de acuerdo con el informe de progreso sobre el acceso y uso racional de los medicamentos y otras tecnologías sanitarias estratégicos y de alto costo. Es muy importante que este documento de política se siga implementando en todos los niveles de acción, tanto al nivel nacional como subregional y regional. Estamos muy interesados en poder avanzar en estrategias como la evaluación de tecnologías sanitarias, el intercambio de información y la formación de recursos humanos. Es de suma importancia el fortalecimiento de los mecanismos de adquisiciones conjuntas, subregionales y regionales, así como en iniciativas para el fortalecimiento regulatorio. Consideramos que la Organización Panamericana de la Salud y la Organización Mundial de la Salud juega un rol técnico y de facilitación de procesos integradores muy importante. Muchas gracias, señor presidente.
Gracias, Honduras. Brasil.
Obrigada, senhor presidente. O Brasil tem avançado de forma significativa em relação ao acesso e uso racional de medicamentos e outras tecnologias em saúde estratégicos e de alto custo, apesar de nossas dimensões continentais e diferentes perfis epidemiológicos. Avançamos na qualificação e estruturação da assistência farmacêutica, nos investimentos dispendidos, na incorporação de novas tecnologias ofertadas pelo SUS e na produção local de produtos de saúde, democratizando o acesso às ações e serviços no âmbito da assistência farmacêutica. O acesso a medicamentos seguros, eficazes, de qualidade e a preços acessíveis para todos é temática reconhecida internacionalmente. No Brasil, investimos na Relação Nacional de Medicamentos Essenciais, periodicamente atualizada, como instrumento racionalizador. Nossa Agência Nacional de Vigilância Sanitária, reconhecida pela OPAS como Autoridade Regulatória Regional, garante o acesso da população a serviços e produtos seguros, eficazes e com qualidade. Construímos o Banco de Preços em Saúde e estabelecemos a Câmara de Regulação de Medicamentos como mecanismos reguladores e de monitoramento do mercado de insumos e produtos estratégicos para a saúde, além de participarmos ativamente do Fórum sobre Fixação de Preços Justos. Implementamos um programa de parceria público-privadas, as parcerias para o desenvolvimento produtivo, como estratégia para estimular a produção de medicamentos e produtos para a saúde estratégicos para o SUS e promover o acesso, reduzindo nossa dependência do mercado externo. Reconhecendo a relevância da produção local como elemento estratégico para atender às necessidades dos pacientes e preservar o acesso a medicamentos, vacinas, diagnósticos e demais produtos de saúde, principalmente em situações de emergência, apoiamos firmemente a resolução sobre o aumento da capacidade de produção de medicamentos, tecnologias em saúde na OPAS, além de copatrocinarmos a iniciativa Call to Action no âmbito da OMS. Ressalto aqui que o Ministério da Saúde disponibilizou em 2021 um montante extra de cerca de 216 milhões de reais em resposta a emergências de saúde públicas decorrentes da pandemia da Covid para aquisição de medicamentos e insumos para assistência farmacêutica. Temos um comitê para a promoção do uso racional de medicamentos de caráter consultivo, propositivo, tendo por finalidade orientar e propor ações estratégicas e atividades para a promoção do uso racional de medicamentos no âmbito da Política Nacional de Promoção de Saúde. O Brasil agradece o secretariado pelo relatório de progresso sobre a execução de políticas de acesso e uso racional de medicamentos e outras tecnologias em saúde estratégicos e de alto custo apresentado e manifesta seu apoio e compromisso com as recomendações por acesso e uso racional de medicamentos e outras tecnologias em saúde na região das Américas. Obrigada.
Obrigado, Brasil. Mr. Director, over to you.
Thank you very much, Mr. President. And thank you to all the member states for your comments on this report. As I mentioned yesterday, one of the principal drivers in expenditure in health at the moment is medicines and health technologies. I think we're all seeing that across the region. And one of the principal areas of concern in terms of out-of-pocket expenditures in healthcare relates specifically to the issue of medicines and technologies, which is increasing at a faster rate than any other, particularly in terms of services, any other component of out-of-pocket expenditures. So this issue of access to medicines continues to really be a priority area of work, I think, for all of us, both secretariat and countries, as we move forward. This report is closely linked to what we have already discussed around strengthening regulatory systems, and of course the discussion we had on the importance of using evidence-based processes to guide decisions for health technology assessment. But I think there's an important issue that also the report raises, and it's how a fragmented approach to the issue of medicines is essentially being taken across the region, where countries are specifically working either on regulatory issues or access and use or health technology assessment or procurement, the various subcomponents without a real holistic approach, a policy approach, as was very well highlighted by the delegate from Panama, that is really required to address the complexity of issues that ultimately impact availability, access, and affordability. The approach, therefore, should really focus on the complete elements and functions of the policy cycle, from selection based on best evidence, the use of essential medicines, rational use strategies, strategies to really strengthen services, increase pricing transparency, and linked with that then the regulatory strengthening component that will support the rapid introduction of generic medicines in the region. In a recent report that we produced by the Secretariat, we did note that generic penetration in Latin America and the Caribbean is only 30% of that we see in the United States. The United States being a reference in terms of the use of generic medicines within the healthcare system. Only 30%, which means we have a lot more work to do to really effectively regulate generic medicines and then ensure their integration, deployment, and as Panama again mentioned, the practices that are required to support prescribing of generic medicines within health systems. But regulation doesn't stop just in quality. We also have to look at the intellectual property frameworks and the other regulations that often impact procurement processes, which in turn will result in favorable conditions or not for access. And so it's this policy, it's the collective approach that is really required, and this is what the report is urging. Thank you to Honduras. We will continue to really support and the implementation strategies around this, and we will, of course, Panama, come back to you jointly with Argentina and other countries from the South to have and support this integrated approach that's really required in the area of access to medicines. Thank you very much.
Thanks, James. Madam Senior Director, any comments?
No, I think this was very well said. Thank you.
I call my bosses the grand poobahs, so you're the grand poobah. Okay, look, that takes us to the end. I'd like to indicate discussions on this item will be reflected in the final report. We'll take a short break, 15 minutes only, please. And we'll come to our last substantive item, 8-8.13. Recall, I said yesterday that we will take ABC all together. And I'll give a bit more time for delegations to be able to speak to all three items at once. So reconvene no later than 11:15. Thank you.
The nationally determined contributions, NDCs, meet the commitments made by countries to face climate change. They include adaptation to climate change and mitigation actions, the reduction of greenhouse gas emissions and other atmospheric pollutants. Their implementation brings about benefits: reduction of the number of deaths, number and length of stay in hospitals, number of sick leaves, and respiratory and cardiovascular disease cases related to the quality of the air, among other consequences for the public health system, the companies, and the state. In order to quantify the benefits brought about by NDCs, the World Health Organization developed a tool called Carbon H. Carbon H allows legislators, voters, decision makers, and entrepreneurs to have the information they need on the expected effects on health of the enhancement of the air quality. The NDC, as prepared by Colombia, encompasses 148 measures aimed at reducing greenhouse gas emissions by 51% by the year 2030, as compared to 2014. By using the Carbon H tool, it is estimated that some of the health co-benefits of implementing the NDCs are avoiding 25,600 deaths over the period 2021 to 2030, and 3,800 per year after 2030. As of 2030, 2,750 cases of hospitalization per year caused by respiratory and cardiovascular disorders will be avoided, reducing 892,000 asthma episodes in children per year after the year 2030. This represents economic benefits for the public health system of up to $12.9 billion during the period 2021 to 2030, and of $1.8 billion per year, or the equivalent of 0.64% of GDP, as of the year 2030. Carbon H is free of charge for countries, and PAHO is committed to providing the necessary technical cooperation to make the most of it by adding the healthcare costs and tangible figures to the climate actions. You're the only one missing. Visit www.paho.org and get acquainted with the experiences, applications, and possibilities offered by Carbon H.
Hello, Paula.
Buenos dias. Bom dia. O que você gostaria de falar hoje?
Hola.
Oi.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use.
Why we developed Paola? The COVID-19 pandemic amplified two chronic problems we had with alcohol. One is misinformation on the internet and social media, and the other is the limited health professional capacity to deal with alcohol problems in the health system. Therefore, the pandemic accelerated the need for a trusted and reliable source of information to improve health literacy related to alcohol, as well as to help people assess their risk and decide on a change plan towards a healthier lifestyle.
Yeah.
What or who is Paola, and why do you think we need her?
I was built to provide reliable information about the impact alcohol can have on your health. I want to help reduce your risk of harm from alcohol use.
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Paola is a conversational agent created by Paola, the first in the world dedicated to alcohol topics. She's built with artificial intelligence and the latest scientific information on hundreds of alcohol-related topics. Paola speaks English, Portuguese, and Spanish to an unlimited number of users, 24 hours per day, 7 days a week, in a way that is totally anonymous, confidential, and free to the user. She can be reached by mobile phone, desktop, tablet, or other similar device.
Why a digital health specialist for this obviously really important function? What was your decision there?
Paola can answer your questions on alcohol and health or alcohol-related harms, can screen for your alcohol risk, and guide you towards a change or quick plan. She can also refer users to treatment resources in their own country. Paola is empathetic, engaging, her conversations are anonymous and non-judgmental. The capacity of digital people is enormous to reach more people where they are at a minimal or no cost. It can reduce the workload of health professionals and give them more time to talk to their patients when necessary. Compared to mass campaigns of education or education in schools, digital solutions like Paola have the potential to be so much more cost effective.
Provokes in humans a limbic system response, if you like. So you can retain more information and you can do it for longer.
Paola is completely innovative, but is based on established evidence-based principles.
In fact, artificial intelligence has become the new frontier in health.
Technology designed to improve knowledge, promote health with personalized, non-judgmental engagement, and ultimately to save life.
It is a great step forward.
Think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
The Americas, a dynamic region full of diversity, and yet the most unequal in the world. 201 million people still live in poverty. Illnesses such as obesity, diabetes, hypertension, and high cholesterol are more prevalent among poor and vulnerable populations. The mortality rate is twice as high for children under 5 with undereducated mothers. And every year, 2 million babies are born to mothers between the ages of 15 and 19. It is our duty to protect those who are most in need. We will do whatever is necessary to ensure that no one is left behind. We've been doing so for over a century, and we're not going to stop now. Because our determination doesn't stop. Our dedication doesn't stop. Our commitment to our communities doesn't stop. And because life doesn't stop. Health is the most precious resource we have and an engine of sustainable development. It helps to close gaps and reduce inequalities. Investing in resilient healthcare systems is vital for their recovery and preparation for the future. However, no single nation or organization can tackle the health challenges facing the Americas alone. We are the partner of choice to promote public health and the best resource to improve the quality of life in our communities. We provide coverage in all countries, management and supervision of projects at the regional and national level, knowledge and networks in all areas of healthcare, capacity to convene people, mechanisms of transparency, and experience with responding to emergencies. Building partnerships has been essential to improving healthcare in the region. Life expectancy has increased by 36 years. The mortality rate for children under 5 has been reduced by 67%. Hundreds of millions of people have been able to get vaccinated and obtain access to medicines. Smallpox, polio, rubiola, and measles have been eradicated. Each of these achievements demonstrates what can be attained through collaboration. And yet, we still have much work to do. Many people's lives depend on us. Let us continue working together to bring health and hope to every corner of the Americas. The Pan-American Health Organization.
There is a silent threat we can confront and beat when empowered with information. Around 57% of cases of liver cirrhosis and 78% of liver cancer worldwide are caused by infections, which in turn are caused by hepatitis B or C viruses. These viruses may produce an inflammation of the liver. Some of the common symptoms are fever, nausea, vomiting, abdominal pain, skin rash, jaundice, loss of appetite. However, in most cases, symptoms caused by the virus do not show for years until the disease becomes chronic. Knowledge is power. Moreover, in order to prevent the spread, we must bear in mind that both hepatitis B and C are transmitted by contact with infected blood due to unprotected sexual relations, mother to newborn contact during delivery, sharing needles, and other personal and intimate objects. A vaccine against hepatitis B is available for people of all ages. A single dose administered to a baby within 24 hours of delivery, followed by a comprehensive vaccination plan during the first 12 months of the child, may avoid transmission of the virus from an infected mother to her child. A routine vaccination plan for children and adults belonging to groups at risk, such as healthcare workers, is the best way of achieving immunity for the population from hepatitis B. In the case of hepatitis C, there is no vaccine to prevent contagion, but there are treatments that cure the infection for good, thus avoiding complications and transmission to others. Remember, knowledge is power. That's why, ask for a hepatitis B vaccine for your baby. Practice safe sex. Do not share syringes, needles, or other objects that may contain contaminated blood. And last but not least, go get tested. Do not hesitate to get a test in order to have a hepatitis diagnosis. If we act mindfully, we may achieve our goal to eradicate viral hepatitis in the Americas by the year 2030.
Las tecnologías perinatales elaboradas por el CLAP son herramientas que permiten acompañar el cuidado de las mujeres embarazadas en el periodo prenatal, durante el trabajo de parto y en el parto, así como en el control de los recién nacidos. Son instrumentos de bajo costo y de alto impacto en la atención primaria de salud, pero también lo son para especialistas que asisten a niveles de mayor complejidad.
Son fáciles de utilizar, de interpretar, trasladar y facilitan la atención oportuna tanto de las gestantes como de los recién nacidos.
Esto con esto, y la cita, me voy al medio del campo y yo controlo el embarazo.
Al calendario obstétrico se le agregaron medidas de algunos parámetros seleccionados que permiten calcular la menorrea, vigilar el crecimiento y la vitalidad fetal y estimar la edad del embarazo, la edad del recién nacido y verificar la normalidad del incremento del peso materno, de la presión arterial y la contractilidad uterina, entre otros parámetros. Este disco permite detectar casos con restricción del crecimiento fetal o macrosomía fetal, alteraciones de la duración del embarazo o una contractilidad mayor a la correspondiente a la edad gestacional. Además, si se desconoce la fecha de la última menstruación, nos permite estimar la menorrea a partir de las medidas ecográficas embriofetales. A partir de la semana 20 se presentan los valores de percentiles 10 y 90 del peso fetal y el percentil 50 de la talla correspondiente a cada semana.
La cinta obstétrica se utiliza para medir la altura uterina durante el embarazo. Permite controlar el crecimiento fetal y recordar los patrones para la vigilancia de la salud materno-fetal. El estetoscopio fetal ilustrado tiene figuras sobre la técnica de auscultación y registro de patrones normales y de desaceleración de la frecuencia cardíaca fetal a partir de la semana 20 de gestación, asociada a las contracciones uterinas en el embarazo y parto. De esto depende su interpretación y las recomendaciones. El estetoscopio de Pinar, a diferencia de otros métodos, tiene la ventaja de no necesitar baterías, dispositivos que a menudo faltan en los lugares de atención. ¿Cómo, perdón?
El dilatómetro es una herramienta que nos sirve como una plantilla para ir viendo el grado de dilatación y de esa forma entrenarnos para la correcta valoración del trabajo de parto. Como podemos ver, se va dividiendo por centímetros, que es la manera como nosotros vamos valorando la evolución normal de un trabajo de parto, y lo hacemos mediante la introducción de nuestros dedos para tener un estimado de la dilatación. Por ejemplo, la dilatación de 2 centímetros nos cabería la introducción de un solo dedo, o la de 10 centímetros cuando podemos abrir al máximo nuestros dedos. Acá.
La cinta neonatal es una cinta métrica diseñada para medir el perímetro cefálico del recién nacido al momento del nacimiento y a las 24 horas si fuera necesario confirmar la medida. En el anverso tenemos impresa una escala de 55 centímetros con divisiones entre centímetros y milímetros. En el reverso contiene los valores correspondientes a -2 y -3 desvío estándar para el perímetro craneano para una edad gestacional conocida para niños y niñas desde las 27 semanas hasta las 42 semanas de edad gestacional. También en el reverso se encuentran los valores normales correspondientes a -2 y -3 desvío estándar de perímetro craneano para niños y niñas de término. Esta tecnología ha sido de gran utilidad para vigilar el síndrome congénito posiblemente asociado al virus del Zika. Este instrumento es de fundamental utilidad para nosotros, los neonatólogos, y en general el seguimiento de los recién nacidos, dado que podemos obtener información clara y precisa acompañado de un instrumento que es fácil de utilizar, nos facilita la valoración de nuestros pacientes.
Although you may not feel it, it's here. The air we breathe is a right. Nine out of 10 people live in cities where air pollution levels are above those recommended by the World Health Organization. Air pollution knows of no borders. It is a global issue, causing inflammation of our airways, cardiovascular diseases, neurodegenerative diseases, preterm births, and skin aging. And it kills almost 7 million people every year. We may reduce pollution levels by demanding laws that limit the emission of gases and particles, by using clean means of transportation, providing for a good disposal of waste products, by opting for energy efficiency. You are part of the solution.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age, adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
A região está diante de uma iminente crise pela considerável diminuição do número de crianças que recebem todas as vacinas. Em 2021, nas Américas, 2,7 milhões de crianças com menos de um ano não receberam ou completaram seus esquemas vacinais básicos devido às interrupções nos serviços de saúde ocasionadas pela pandemia da Covid-19. A pandemia também afetou a vigilância destas doenças e os sistemas de laboratório. A região poderia não ser capaz de detectar o próximo surto de uma doença prevenível por vacinação antes que ela se torne uma epidemia multinacional. Pela íntima relação entre epidemias e a vida em sociedade, estamos não somente ante a um risco sanitário, mas também ante a um risco econômico, educacional e social. Precisamos diminuir o risco de importação e de surtos de doenças que foram eliminadas das Américas, como a poliomielite, a rubéola e o tétano neonatal. Para conseguir isso, os Estados-membros, os parceiros e a Organização Pan-Americana da Saúde devem trabalhar em conjunto para fortalecer todos os aspectos dos programas de imunização, investindo recursos financeiros e aumentando a quantidade de pessoas capacitadas que possam garantir serviços de imunização e sua integração ao sistema de atendimento primário da saúde.
Isto somente vai ocorrer se os governos e os sócios se comprometerem, política e economicamente, a fechar as lacunas na imunização. Como principal colaborador da região em todas as questões de saúde pública, a OPAS está perfeitamente posicionada para ajudar os Estados-membros a priorizar suas necessidades mais urgentes e implementar ações a favor da vacinação. Continuemos com nossa exitosa colaboração para fortalecer os programas nacionais de imunização em toda a região. É possível superar esta crise. Juntos, triunfamos no passado e voltaremos a triunfar. Organização Pan-Americana da Saúde, 120 anos. Somos a Organização Pan-Americana da Saúde. Comemoramos 120 anos de solidariedade na promoção da saúde e bem-estar das pessoas, sem deixar ninguém para trás.
Bom dia outra vez. Bem-vindos de volta. Ah, perfecto. Parece que tenemos quórum. Super. Yo veo a movimiento en Haití, pero ya está. US tomando asiento. Perfecto. Mr. President, we have quorum.
Excellent. Thank you, Monica. First of all, let me apologize for dressing down. It's a bit like Superman getting in a phone booth and changing clothes, but I'm not Superman by any stretch. But I had to check out, so that's why I had to get changed since I didn't want to change clothes in public. Okay, we are down to our final substantive item. 8.13. Resolutions and other actions of intergovernmental organizations of interest to the Pan American Health Organization. We have 3 sub-items here. And again, as I mentioned earlier, we will be taking them not consecutively, but all together. And as a result of that, we have 3 colleagues from the Sanitary Bureau who will be at the head table. Monica, of course, is one of them. Ms. Mariana Faria is a second one. And Dr. Godfried, I really don't know how to pronounce it. Schreber. Okay. Dr. Godfrey, wherever you are, you could join us as well. And I'll ask Representative of the Executive Committee if he can speak to each element at the one after the other before we open the floor. So over to you.
Thank you, Mr. President. A. 75th World Health Assembly. The Executive Committee received a report in June on the resolutions and other actions of the 75th World Health Assembly and of various sub-regional bodies considered to be of interest to PAHO. The committee was informed that the text of the resolutions and decisions adopted by the Health Assembly had not been published at the time that the report was prepared, and that a full analysis of the matters of particular interest to the region would be provided and the report to be submitted to the present Pan American Sanitary Conference. This concludes the report on this item. I will continue to the next. Yep. That's 8.13C, sub-regional organizations. With regard to the report on actions of sub-regional organizations, the Executive Committee was informed that the main aim of PAHO's work at the sub-regional level is to ensure that health issues remain on high-level political agendas in the region. To that end, the Bureau has taken steps to strengthen the 3 sub-regional coordination offices. The Executive Committee's discussions of the report, it was pointed out that sub-regional integration organizations have an important role to play in facilitating sub-regional participation and encouraging consensus in various global processes underway within WHO, including the working group on strengthening WHO preparedness and response to health emergencies, and the discussions on possible amendments to the international health regulations and on new WHO instrument on pandemic preparedness, prevention, preparedness, and response. Thank you, Mr. President. That concludes my report on these items.
Many thanks, colleague. And I think we have Monica, Mariana, and Godfrey here. So they're all available to answer any comments that the floor wishes to make on any or all of these 3 items. So I open the floor. Who would like to speak to these items? This is your last chance. Thank you, Argentina. You have the floor.
Gracias, señor presidente. La Argentina toma nota del informe y destaca la importancia de los foros de integración subregional como el Mercosur y regional como la CELAC. En particular, destacamos las declaraciones recientes de ministros de salud del Mercosur sobre el registro de donación y trasplante de Donasur, sobre el fortalecimiento de la preparación y respuesta de la OMS ante emergencias sanitarias, sobre el abordaje de la RAM y la pandemia de COVID-19. Asimismo, resaltamos de utilidad las reuniones informales de la Comisión Intergubernamental del Reglamento Sanitario Internacional CIRSI, para la preparación de nuestros países en los procesos en curso de la OPS y OMS, como el Grupo de Trabajo sobre Fortalecimiento de la OMS, el órgano de negociación intergubernamental y el proceso de posibles enmiendas al RCI. El trabajo conjunto de los Estados partes de Mercosur en estos temas es muy importante, y en este sentido alentamos a los demás países a consensuar posiciones conjuntas en los temas de relevancia internacional, lo que seguramente fortalecerá el posicionamiento de la región de las Américas. En cuanto a la CELAC, destacamos la Estrategia Sanitaria Latinoamericana y Caribeña, cuyo objetivo es mejorar la coordinación de las capacidades nacionales de la región y potenciarlas para enfrentar mejor los desafíos en materia sanitaria, promoviendo un enfoque solidario entre los países. En su rol de presidencia de la CELAC, la Argentina ha priorizado el acceso a las vacunas producidas en América Latina y el Caribe y la producción y distribución regional de vacunas, diagnósticos, pruebas y tratamientos para la COVID y otras enfermedades a través de la implementación del Plan de Autosuficiencia Sanitaria. Finalmente, promovemos la continuidad de estos grupos regionales de trabajo junto con la colaboración de la OPS para que la voz de nuestra subregión continúe representada en los procesos regionales y globales. Muchas gracias.
Gracias, Argentina. Any other delegations wishing to speak on this? 3 items. 3 sub-items. What do you say this? Going once? Going twice? I think we've all had a long week, and I think we're all at the end. So I will not take silence as being disinterest, and I hope colleagues in the Secretariat notice that as well. I think I would like then to invite, so would each of you like to make a few comments? Godfrey, over to you.
Thank you, Mr. President. I hope can I call you Mr. President, or is it Your Excellency or Your Honorable?
Any works for me. Yeah.
Thank you, Mr. President. Thank you to the delegate of Argentina for that important comment and for giving us the opportunity to also speak on this item. As you heard from the Executive Committee's report, one of the things that we've done as the Secretariat, Dr. Etienne has strengthened the role of the sub-regional offices of PAHO. We have 3 sub-regional offices, one for South America, one for Central America, and one for the Caribbean, with the aim of actually, as the delegate of Argentina said, to strengthen the health initiatives within those sub-regional entities, within the integration mechanisms, but also more importantly to work with the pro-tempore presidencies to set the agenda of the heads of government of the integration mechanisms, to not only discuss health, but also more importantly, as we go along and come out of the pandemic, to discuss the social and other determinants of health, and to ensure that health remains high on the agenda of the presidencies and of these integration mechanisms. So thank you, Argentina, again, and thank you all the member states for all the support and cooperation in the integration mechanisms. Thank you, Mr. Chair.
Many thanks, Godfrey. Liana, anything? Monica, anything to add? Good? Okay. So that brings us, thank you, all 3 of you, for making yourselves available. We're now down to our last item, any other matters, item 9. And I think I turn to Madam Director to see if there's any other matters you'd like to bring to the attention of the conference.
No, Mr. President, no other matters. Thanks.
This is your last hurrah, you know.
I still have to do my closing.
Oh, yeah, you're closing. That's right. You got closing remarks. Saves it for the end, of course. Do any delegates have any other matters that they'd like to bring to the attention of the conference. I recognize the United States.
Thank you, Mr. Chairman and or Mr. President, rather. On behalf of the United States of America, I would just like to congratulate all the delegates on a very lively and productive Pan American Sanitary Conference, and to let our great director Etienne know that we have appreciated her service for the last 10 years and love her dearly and are going to miss her. And we want to thank our Deputy Director, Lou Valdez, for her incredible work over these past many years, and the entire PAHO leadership team. Thank you so much.
Many thanks, U.S., for those kind words to the Secretariat. Any other delegates wish to bring any other items to the table? Seeing none, I think we can move now to our final item, closure of the session. And one more time, Director, Madam Director, you have the floor.
Monsieur le Président, thank you very much. Let me also recognize our distinguished delegates and member states, participating states, or associated member states and observers. Also our distinguished guests, my colleagues and distinguished ladies and gentlemen. So thank you, Mara. I think you wanted to bring a little tears to my eye, but I dried all of them up, so there are none left. Let me greet all of you on the closing of what has been a truly inspiring and productive week of frank discussions, transparent deliberations, and far-reaching decisions. I really thank you for the engaging manner in which you participated at this conference. Is Jabas there? Let me again congratulate Dr. Jabas, and let me assure you, all of you, that my full and unequivocal support will be given to the director-elect as he prepares to take the mantle of the office as PAHO's 11th director in February 2023. Our in-person gathering this week has been an important milestone as we turn the corner on what has been the devastating COVID-19 pandemic and pursue a path towards recovery and reconstruction. I do hope that we have now broken the cycle of mandatory pandemic-induced virtual meetings. This being my last conference as a director of PAHO, I am especially grateful for the formal and informal opportunities that we had to be together this week. When the Directing Council convenes in 2023, delegations will once again be able to enjoy the comfort and the convenience of modernized and enhanced conferencing facilities at PAHO's headquarters on 23rd Street Northwest. And thank you for your patience and your endurance of being not at your home for this conference. Permit me to take this opportunity to extend to the peoples of Cuba and the United States of America our deepest condolences for the loss of lives and the tremendous destruction of property, including health facilities, wrought by Hurricane Ian. Our prayers and thoughts are with you. This week, we discussed and adopted many important policy decisions, among them resolutions to accelerate the region's post-pandemic recovery, to recommit to addressing the social determinants of health, and to elevate the mental health and substance abuse crisis as a regional priority that must be addressed. I heard renewed commitments to genuinely address cross-cutting issues, to close equity gaps, to remove barriers to health for people living in situations of vulnerability, to take those actions necessary for delivering integrated care and to apply intersectoral approaches for improved health outcomes. Your renewed calls for regional solidarity and recommitment to the values of Pan-Americanism, equity, solidarity, and fairness were explicit and I dare say unambiguous. Your acknowledgement that the region's health workforce had borne the brunt of the COVID-19 fight was further amplified by appeals for refreshed and concerted efforts to develop, retain, and reward health workers, especially those at the first level of care. I do appreciate your emphasis for the Bureau's continued prudent management of resources, your calls for pragmatic solutions to problems, and for the payment of quota contributions and reducing the arrears. Let me also, and allow me to reiterate that PAHO, the Secretariat, needs your assessed contributions. Thanks for including the important and timely agenda item on maintaining the region of the Americas free of polio. Thank you also for acknowledging the 10-year track record of unqualified audits during my tenure as director. We in the Secretariat have indeed worked hard to firmly embed accountability, transparency, ethics, and rigorous management of the organization's resources in the very culture and practice of the Secretariat. Ladies and gentlemen, we have lived through the toughest of times, but there are yet formidable challenges ahead. If we ever doubted it, the pandemic has demonstrated yet again that the creation of PAHO some 120 years ago was an act of incredible foresight. Each successive generation has reinforced and added building blocks for achieving health for all, drawing on past lessons and expanding possibilities through new knowledge, better data, health innovations, new technologies, and an undaunted human spirit to do more and to do better. Who knew in 2017, as I accepted a second term as director of PAHO, that my greatest challenges as a leader were yet to come? You have recognized that interactions at the human, animal, and environmental interfaces can trigger major crises, and you have restated your support for the One Health comprehensive, multi-sectoral, multi-stakeholder approach. This week, we discussed and adopted 13 resolutions and covered several key topics. Thank you very much for challenging each other during this conference to do whatever is necessary to reduce inequities and improve people's health and lives by bridging the gap between commitments and action. Today, as I prepare to lower the curtain on my tenure as director of PAHO and to hand over the leadership reins to my successor, I am encouraged to observe a new generation of leaders emerging across the region. Many of you are in this room or participating virtually in the conference. Your talent, your skills, energy, and ingenuity will without doubt be equal to the challenges that lay ahead. You give me optimism about the future of PAHO and health for all in the Americas. In closing, and on behalf of all of us, I would first like to record our deep appreciation to the respective presidents of Dominica and Argentina, and to the Secretary of Health for the U.S. Department of Health and Human Services for their wise opening remarks, which set the stage and tone for the remainder of the meeting. I would also like to convey our special thanks to Mr. President Mike Pearson of Canada for his skillful management of this 30th Pan American Sanitary Conference, for his interjections of good humor, and thank you, Mr. Pearson, for getting us there on time. With time to spare. Let me also thank the President of the Executive Committee, Minister Visotti of Argentina, and our rapporteur from Uruguay, who both discharged their respective functions with diligence and excellence. Let me also thank let me also thank Suriname, who has deputized for Minister Vissotti. I also wish to record our collective thanks to the Deputy Director, Mrs. Mary Lou Valdez, for her easy graciousness as Secretary of this conference. To our governing body's office for their efficient planning, management, and execution of this conference under the competent leadership of Monica Zachary Davovo. You would not have guessed that there was so many added complexities, and the planning to execute this, it seemed almost seamless. To the directors and staff of the technical and enabling departments for enduring the rigorous process to ensure good documents and presentations. To the staff of our departments of communications, information technology, and our general service office for their expert support and multifaceted contributions. To other members of the executive management for your unstinting support and guidance during this conference, but way beyond that. To legal counsel and their staff for the exceptional management of the election process in accordance with the highest standards of transparency and integrity. And to all the personnel of the Secretariat for their sterling contributions, their tireless efforts, and their magnanimous support both during this week and in the preceding preparatory period. I wish to add my personal word of thanks to my Chief of Staff, Dr. Merle Lewis, and the hardworking, really industrious team in the Director's Office. I am very grateful for your continued support, your love, and your care. And on behalf of all the delegates, I want to extend a wholehearted thank you to our talented interpreters who make it possible to understand each other. Else we would have been in the Tower of Babel. So, ladies and gentlemen, I assure you that I will continue to give of my very best to PAHO until Dr. Javas assumes the position in 2023. Thank you for your many kind words and your acts of generosity to me during this conference, but throughout my tenure of 10 years. We couldn't do it without the support and commitment of all of our member states. Thank you for allowing me to work alongside you. I encourage everyone with a vision and big dreams to make this world a better place, to continue to reach up and up and up beyond your grasp. You will be surprised at what is possible. And it has been really for me an undisputable honor for me to serve the people of the Americas as the director of PAHO. I feel privileged yet humbled that you trust me, and it has reaped good results. I wish you au revoir, safe travels, and Godspeed as you return to your respective homes. With profound thanks.
So Carissa, I gave you flowers once, but we're giving you flowers again. This time in a big jar.
Thank you so much.
A heavy jar, so there you go.
I take it home to my mama.
Many thanks, Teresa. I noticed that you did not miss one final opportunity to ask for everybody to give their assessed contributions. And I respect that, among all the other many great things that you said. Before I close the conference, Lou, I have an announcement from you, so please go ahead.
Yes, thank you, Mr. President. One announcement. We would like to remind delegates that the 171st session of the Executive Committee will take place in this room starting at 2 p.m. All delegates are welcome to attend the session. The Executive Committee members are Argentina, Bolivia, Brazil, Chile, Cuba, Jamaica, Suriname, United States of America, and Uruguay. Thank you, Mr. President.
So, Mr. President, before the final gavel, I want to give you your personal gavel.
Thank you. Can I take it out and use it as?
You don't want to break it now.
My notes say bang the hammer. So, but just before I do that with this one, not this one, I want to just echo, frankly, many of the things that Teresa said. I want to start with our interpreters as well. It's a fantastic job that they've done over the 3.5 years that I've been coming to PAHO meetings. I hear the familiar voices every time. They do a fantastic job keeping up with everybody. And I just want an additional sort of reflection from the president about how much I value, and we all value their contribution. So one more applause for interpreters. Teresa, you mentioned many members of the Secretariat, and there are many members of the Secretariat who made this conference a success. And I want to just again echo your comments in that regard and your thanks, including the senior leadership with you, like Lou and Heidi and Monica and many others as well. Many others here at the front who have helped me to make sure I could remember who had to speak next. That was really very important and helpful to me. And again, I want to echo you in thanking our rapporteur or tours, or it's our one rapporteur and our 2 executive committee representatives who so effectively did their jobs this week. And one other group that I think we often don't mention or recognize, but have an equally important and a very silent job, which is our guards. At the entrance, at the other entrance, always checking to make sure that you have legitimate access to be here. They do a great job. They're great people, and I just want to offer my thanks to their contributions as well. And Madam Director and Director-elect Dr. Yadabas, particularly to Director-elect Yadabas, remember that we, as part of this week's events, decided and announced that Madam Director would become Director Emeritus of the Pan American Health Organization, and that maybe that'll be more than just a title. You will have constant opportunity, I am sure, to continue and be welcomed at any time to continue to participate and to be part of this family. Not looking over the shoulder of your successor, but offering him the sage advice that I know you will be able to do on an ongoing basis, not just over the transition period. And I know he will welcome your contributions. So it's been an honor to serve as your president. Very much enjoyed the experience and enjoyed working with all of you. And on that, I will declare the session closed. Thank you. Here we go.
I have a box for you.
So great.
Michael, I'm sorry to have, yelled at you. I didn't mean that.
No, no, no.
I didn't yell at you.
You guys.
That's just my
are a
job.
fantastic triumph. Yeah.
Thank you so much.
Thank you. Well done.
Sure. Yeah. All the best. Can I have a picture with you?
Yes, of course. You want someone to take it? Take a picture.
Oh. Give me a hug. I didn't yell at you. I only yelled at my.
Thank you very much. You came out okay. Is it? What story is she going to tell us? Great to meet you. Stay in touch.
It's been an honor.
Thank you so much.
See you next time.
Yes,
Okay?
see you. We'll see. Thank you very much.
Thank you. And next time don't go with
Thank you. I hope it could do.
David.
Thank you. I will be back at the headquarters.
I hope
Yeah,
so.
can we come over?
They don't do it like this. Years.
Hello, Paula.
Buenos días. Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños. Olá, o meu nome é Paola. Eu sou a primeira especialista digital em saúde e consumo de álcool da Organização Pan-Americana da Saúde. Fui criada para fornecer informação confiável sobre o impacto que o álcool pode ter na sua saúde. Também posso te ajudar a entender se o seu consumo de álcool está colocando a sua saúde em risco e guiá-lo em um plano para reduzi-lo. Você acha que beber menos poderia te beneficiar?
Tenho certeza. Por favor, você pode me ajudar?
Também gostaria de te ajudar. E prometo que não vou te julgar ou criticar. Afinal, sou uma pessoa digital. Eu não sei julgar.
7:05.
Muy buenas tardes, tengan todas y todos. Bienvenidas sean todas las personas a este comité ejecutivo, en donde les informo que hay quórum, dado que tenemos la totalidad de los países que pertenecen a este comité ejecutivo. Por lo tanto, declaro abierta la sesión de este comité, sobre todo dando la bienvenida a los 3 nuevos miembros de este comité ejecutivo: Chile, los Estados Unidos de América y Uruguay. Bienvenidos. Secundario, vamos a ver el punto 2 del orden del día. Punto 2.1, la elección de la mesa directiva. Solicito atentamente a nuestra querida Marilu Valdés que presente las disposiciones reglamentarias relacionadas con este punto.
Thank you, Mr. President. Rule 15 of the Rules of Procedure of the Executive Committee states, "The committee shall elect a member of the committee to the presidency, the vice presidency, and the office of the rapporteur respectively. They shall hold office until their successors are elected. Each elected member shall designate a person on its delegation to serve in that office for the duration of the session. The elections shall take place each year at the first session of the committee, following the election of the new members of the committee by the council or conference. Thank you, Mr. President.
Muchísimas gracias, secretaria. Informo al comité que en virtud del acuerdo logrado en la reunión de jefes de delegación, se ha propuesto a Jamaica para ocupar la presidencia. Si están todos de acuerdo, si hay alguna objeción, por favor, manifiéstenlo en este momento. Siendo que no hay ninguna objeción, declaro elegido por aclamación a Jamaica e invito al delegado de ese país, de Jamaica, a ocupar su puesto en la mesa de honor. Señor ministro. Muchas gracias.
First of all, let me begin by thanking this very important body for the confidence reposed in myself and Jamaica as a country to provide this level of leadership over the next year. I accept this position with humility and will certainly attempt to provide all the guidance that is necessary in the consensus approach that we are accustomed to here at PAHO. A lot is in store and is required of us in the context of the post-COVID period. We still are dealing with COVID, but I think we are more concerned at this point with the side effects of COVID, and there are so many. And so I certainly look forward to ensuring that the agenda items are addressed with all contributing, and hopefully over the next year, we would be in a better place in the Americas based on decisions taken around public health. I would like to inform the committee that by agreement reached in the heads of delegation meeting that Cuba has been nominated to the vice presidency, and I'd like to ask the group here if we are all in agreement. Any objections? No. If there are no objections, I declare the delegate of Cuba elected by acclamation. I'd like to inform you that under the agreement also reached at the meeting of heads of delegation, Bolivia has been proposed to serve as rapporteur, and would ask delegates here if we're in agreement or if there are any objections. I see no objections, and therefore I declare Bolivia elected by acclamation and invite the delegate of Bolivia to take a seat. Can I ask those persons to join me here at the Bolivia, Bolivia. Thank you very much. I'd like to inform the committee that there is no need to adopt a resolution on the item. The appointments will appear as a decision in the final report. I therefore proceed to the next item on the agenda, item 2.2, adoption of the agenda. I'd like to bring document CE 171/1, revision 1 to the attention of the committee and would request the secretary to present the provisional agenda and report on the statutory provisions concerning this item.
Thank you, Mr. Chair. The provisional agenda, document CE 171/1, revision 1, was prepared by the director and distributed in accordance with the rules of procedure. Rule 9 provides that the committee shall adopt its own agenda and in doing so may make such additions or modifications to the provisional agenda as it may wish in accordance with these rules. The provisional agenda for the 171st session of the Executive Committee presents the customary agenda items for the September session of the Executive Committee, which includes procedural matters such as the election of the officers of the committee and the adoption of the agenda, committee matters such as the election of 2 members to the subcommittee on program budget and administration, and the appointment of the award committee for the PAHO Award for Health Services Management and Leadership 2023. Under governing body matters, the executive committee will review and approve the proposed dates and topics for meetings of the governing bodies of PAHO in 2023. In addition, the executive committee will review the update on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation under administrative and financial matters. Thank you, Mr. President.
Thank you very much. I open the floor now to the plenary to begin discussions. And we'll recognize you according to your indication to present. Okay. If there are no objections, I declare the agenda adopted. We will now proceed to the next item, item 3.1, election of 2 members to the subcommittee on program budget and administration on the expiration of the period of office on the executive committee of Costa Rica and Mexico. I bring to your attention item 3.1, the provisional agenda, and would request the secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. The Subcommittee on Program, Budget, and Administration is composed of 4 members elected from among the membership of the Executive Committee and 3 members designated by the Director. As the period of office on the Executive Committee of Costa Rica and Mexico expired, it is now necessary to elect 2 new members from among the membership of the Executive Committee to serve on the subcommittee in their place. Brazil and Jamaica continue to serve on this subcommittee for 2023. If the number of candidates does not exceed the number of vacancies, Rule 45 of the Rules of Procedure states, elections shall normally be held by secret ballot. When the number of candidates for elective office does not exceed the number of offices to be filled, no ballot shall be required, and such candidates shall be declared elected. Where ballots are required, 1 teller shall be appointed by the president from among the delegates. Thank you, Mr. President.
Thank you very much. I yield the floor to the director to present the item.
Thank you, Mr. President. And as this is the first time I take the floor, let me congratulate you on assuming the presidency of this meeting, and let me also welcome all new member states through the Executive Committee. The director wishes to propose Argentina and the United States of America as agreed in the meeting of heads of delegation.
Thank you, Madam Director. If there are no objections, the president declares Argentina and the United States. If there are no objections, that is. Are there any objections? Very cooperative body this morning, this afternoon. Very well. I think we. Okay. So since there are no objections, I declare Argentina and the United States of America elected. I know that this will appear as a decision in the final report. We will now proceed to the next item, item 3.2, appointment of the award committee for the PAHO Award for the Health Services Management and Leadership 2023. I'd like to bring the document CE 171/2 to the attention of the committee and invite Dr. James Fitzgerald, Director of the Department of Health Systems and Services, to come to the head table and present the particular item.
Thank you very much, Mr. President, Director Dr. Tien, members of the Executive Committee. Every year, the governments of the countries of the Americas, acting through their representatives at the meetings of the governing bodies of the Pan American Health Organization, confer the PAHO Award for Health Services Management and Leadership. In 2022, just earlier this week, the Award for Health Services Management and Leadership was conferred on Carla Gabriela Roma Perez of Bolivia. In 2023, the award will again be conferred on a candidate who has made a significant contribution in his or her home country and throughout the region of the Americas. The director of the Pan American Sanitary Bureau will invite member states to submit no more than 2 nominations for the award through a call for candidates during November of each calendar year. The names of the candidates proposed by each member state must be received by the director no later than the 31st of March in the year of the award, in this case, March 2023. According to the procedures adopted in the 158th session of the Executive Committee in 2016, and thereafter by the 56th Directing Council, the Award Committee will be selected each year during this first session of the Executive Committee. The members of the Award Committee will receive the nominations prior to the 172nd session of the Executive Committee for their review. The Bureau will then arrange a meeting of the Award Committee for the members to deliberate on the proposed candidates and submit recommendations during the week of the session of the Executive Committee, June 2023. The Executive Committee therefore is invited to nominate a delegate and an alternate from each sub-region to serve in the Award Committee, together with the President of the Executive Committee. Thank you, Mr. President.
Thank you. So to facilitate the deliberations on this item, I would like to propose Bolivia and Suriname as principal members of the Award Committee, and Cuba and the United States of America as alternates. With this proposal, all sub-regions would be represented. And so with that in mind, I now open the floor to the plenary for any comments, discussions, deliberations. Very well. If there are no objections, then I certainly declare Bolivia and Suriname as principal members, and Cuba and the United States of America as alternates. I would like to inform the committee that there is no need to adopt a resolution on the item. Appointments will appear as a decision in the final report. Thank you. We then move to item 4.1, proposed dates for meetings of the governing bodies of PAHO 2023. The 17th session and also the 17th session of the Subcommittee on Program, Budget and Administration. I'd like to bring to the attention of the committee document CE 171/3 subitem A, which refers to the proposed dates for the 17th session of the Subcommittee on Program, Budget and Administration, and ask the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Under its terms of reference, the Subcommittee on Program, Budget, and Administration shall hold at least one session a year. Additional sessions of the subcommittee may be convened in the years when the program budget of the organization is being considered. The members of the Executive Committee are asked to set the dates of the 17th session of the Subcommittee on Program, Budget, and Administration. Sessions of the subcommittee are held at the headquarters of PAHO on dates established by the director in consultation with the Executive Committee. Thank you, Mr. President.
Thank you very much. I will now yield the floor to the director to present the item. Madam Director.
Thank you, Mr. President. I would like to propose that the 17th session of the Subcommittee on Program, Budget and Administration be held from the 22nd to the 24th of March, 2023.
Thank you, Madam Director. I now open the floor to the plenary to begin discussions. Any objections?
Easy job.
Very, very nicely. All right. If there are no objections, I declare that these dates be approved. That is the 22nd to 24th March 2023. On item B, 172nd session of the Executive Committee, I would like to bring document CE 171/3 sub item B to the attention of the committee, which refers to the proposed dates for the 172nd session of the Executive Committee, and would request the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Article 17A of the PAHO Constitution provides that 2 regular meetings of the Executive Committee shall be held every year. The members of the Executive Committee are asked to please set the dates of the 172nd session of the Executive Committee. Thank you, Mr. Chair.
Thank you very much, Madam Secretary. I yield the floor now to the Director to present the item.
Thank you, Mr. President. The Director proposes that the 172nd session of the Executive Committee be held from the 26th to the 30th of June, 2023.
Thank you, Madam Director. I now yield to the floor for any comments, suggestions on the proposed dates. If there are no objections, I now declare that these dates be approved. Thank you. To continue, item 4.1, proposed dates for meetings of the governing bodies of PAHO 2023, the 60th Directing Council of PAHO, the 75th session of the Regional Committee of the WHO for the Americas. I'd like to bring to the attention of the committee document CE 171/3 subitem C, which refers to the proposed dates for the 60th Directing Council of PAHO, the 75th session of the Regional Committee of the WHO for the Americas, and asks the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Rule 1 of the Rules of Procedure of the Directing Council states, the Director shall convene sessions of the Council in conformity with Article 12, Paragraph A of the Constitution. The members of the Executive Committee are asked to set the dates for the 60th Directing Council. Thank you, Mr. President.
Thank you very much. I yield the floor now to the Director to present on the item.
Thank you, Mr. President. I propose that the 60th Directing Council of PAHO, the 75th session of the Regional Committee of WHO for the Americas, be held from the 25th to the 29th of September 2023. Please note that these dates take into account the global calendar of the World Health Organization, other regional committees, and the dates of the general debate of the UN General Assembly in 2023.
Thank you very much, Madam Director. With those dates in mind, I now yield the floor for any comments. Okay. If there are no objections, I inform the committee that there is no need to adopt a resolution. The approved dates will appear as a decision in the final report. And we're moving very nicely now to item 4.2. Proposed topics for meetings of the governing bodies of PAHO 2023, 17th session of the Subcommittee on Program, Budget and Administration. I would like to bring to the attention of the committee document CE 171/4, which refers to the proposed topics for the 17th session of the Subcommittee on Program, Budget and Administration, and ask the Secretary to report on the statutory provisions concerning this item.
Thank you, Mr. President. Rule 4 of the Rules of Procedures of the Subcommittee on Program, Budget and Administration states, the Director of the Pan American Sanitary Bureau shall prepare the provisional agenda of sessions of the subcommittee, and it shall be dispatched with the notice of convocation. The provisional agenda shall include A, any item, the inclusion of which has been ordered by the conference, B, any item, the inclusion of which has been ordered by the council, C, any item, the inclusion of which has been mandated by the executive committee, D, any item, the inclusion of which has been mandated by a member of the subcommittee, E, any item proposed by a member state, participating state, or associate member, and F, any item proposed by the director. Thank you, Mr. President.
Thank you very much, Madam Secretary. I yield the floor now to the Director to present the item.
Thank you very much. And I am pleased to present a number of items that the Secretariat would suggest to be included under policy matters for discussion in the governing bodies for 2023. SBB, sorry. So waiting. Thank God for Monica Davoli. Really. So thank you, Mr. President. These agenda items, as suggested, are really the usual agenda items that are taken under the Subcommittee on Program, Budget and Administration. They include the outline of the proposed program budget of the Pan American Health Organization 24-25, the scale of assessed contributions for 24-25, the engagement with non-state actors, the non-state actors in official relations with PAHO, the appointment of one member to the Audit Committee of PAHO, overview of the financial report of the Director, update on the appointment of the external auditor of PAHO for 24-25 and 26-27, amendments to the financial regulations and financial rules, amendments to the Pan American Sanitary Bureau staff regulations and rules, human resources, management of the Pan American Sanitary Bureau, update on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation, report on the status of the emergency loan from the revolving fund for access to vaccines to the regional revolving fund for strategic public health supplies, Latin America and the Caribbean Center for Health Sciences, BREMI, and a report on strategic issues between PAHO and WHO, the draft provisional agenda for the 172nd session of the Executive Committee. This is all regular stuff that comes up every year.
Thank you very much, Madam Director. I now yield the floor to the plenary to begin discussions on the proposed topic for the 17th Subcommittee on Program, Budget and Administration. Are there any comments? Suggestions? Okay, thank you very much. I would like to invite the director if she has any comments on the lack of comments on the agenda item.
No, I think member states recognize that these that's the usual agenda and
Okay,
the usual topics.
excellent. So
They-
we're all aligned.
Good then.
All right, so I would like to inform the committee that there is no need to adopt a resolution. The approved topics will appear as a decision in the final report. And I continue on item 4.2B, 172nd session of the Executive Committee. I'd like to bring to the attention of the committee document CE 171/5, which refers to the proposed topics for the 172nd session of the Executive Committee, as well as the 174th and 176th sessions, and request the Secretary to read the statutory provisions concerning this item.
Thank you, Mr. President. Rule 6 of the Rules of Procedure of the Executive Committee states that the provisional agenda of a session of the committee shall be prepared by the director. Rule 7 states the provisional agenda shall include A, any item the inclusion of which has been ordered by the conference, B, any item the inclusion of which has been ordered by the council, C, any item proposed by the committee, D, any item proposed by a member or associate member, and E, any item proposed by the director. Thank you, Mr. President.
Thank you very much, Madam Secretary, and I now ask the director to present the item.
Thank you, Mr. President. Mr. President, I would like to propose for the consideration of member states the following items under procedural matters, committee matters under the overall heading of those. The non-state actors report on the ethics committee, report of the investigation office, and report of the audit committee, and appointment of one member to the audit committee. In addition, Mr. President, I would like to introduce some policy matters as agenda items to be considered by member states. The first one is the life course approach, a comprehensive and inclusive vision for today's health systems and public health approaches. As you may know, the Americas has the fastest longevity increase in history, but the improvement in healthy life expectancy has been limited. So we are presenting this document so we can have some alignment for public health action and health systems with consideration of looking beyond just disease-oriented models and to favor a common understanding of the nexus between health systems, people's life expectancy and healthy living, and the health system. The other agenda item that we'd like to propose under the policy matters is the Health Workforce 2030, Strengthening Human Resources for Health for Resilient Health Systems. This document will link with the strategy to build greater resilience in health systems and tackle the long-standing deficiencies in the health workforce pre-pandemic, building on innovations in human resources for health policies during COVID-19 and a fit-for-purpose health workforce to retake the 2030 health agenda. And this document or this agenda item has already begun its discussion. You will recall that on Monday we had a side event that looked at the health workforce. So there are various aspects that will be dealt with, the various pillars, availability and distribution and quality of health workers, the capacities, increasing capacities through virtual learning platforms, strengthening leadership and governance for health systems transformation, and of course, pandemic preparedness and response. So this is an agenda item that all of them come highly recommended. The other one is preventing and controlling NCDs in children, adolescents, and young adults to promote better health throughout the life course. This policy document is proposed to describe the current situation of health and wellness with a focus on NCD risk factors and common NCDs in children and adolescents in the Americas. Most of our policies have focused on more general ages, but this one is targeting our children and adolescents and looking at the multi-sectoral policy options for addressing undernutrition, preventing obesity, improving school environment for healthy eating and physical activity, strengthening self-esteem, autonomy, and healthy self-image to mitigate exposure to NCD risk factors such as alcohol, tobacco, illicit substance use, utilizing fiscal policies to prevent the consumption of unhealthy products in this population group. And then which I have lost now, Monica. We will also request your admittance of 2 information documents to your deliberations in the governing bodies. The first one is increasing the critical capacities for cybersecurity management in the health sector. During the executive committee, we held a side event on this matter, and there was highlighted then a great need for and an urgent need for open access to online data sets, online tools, and critical information products. But it was recognized that the security needed to be increased significantly. So this agenda item. Its aim is to support countries so that health institutions are better prepared against potential cybersecurity threats and attacks in the health sector. And this is particularly important because many of our countries are moving into digitalization, particularly of medical records. The other information item is strategic positioning of the PAHO revolving fund for access to vaccines in the new era. The COVID-19 pandemic truly demonstrated the importance of building and strengthening resilience in the region for vaccine production to address future emergencies. It has also challenged the sustainability of immunization programs given the economic downturn. The revolving fund for access to vaccine as a strategic regional public good plays a critical role in a new era where it should connect with regional vaccine production initiatives, collaborate with global partners to foster greater price competitiveness of expensive vaccines such as PCV, rotavirus, HPV, and to position its capacity for pandemic preparedness and response. So these are the two information items. Over to you, Mr. President.
Thank you very much, Madam Director. And before I open the floor to the plenary for discussion, I wanted to raise the possibility of an additional agenda item, Madam Director. I crave your indulgence, distinguished delegates. I've been Minister of Health for almost 7 years and have had to confront, as all of us have, and PAHO, significant health threats, with COVID being, of course, the most significant. And in that, we have seen crises like the NCD crisis that we all face, the lifestyle-related crisis, still lingering and even getting worse. Our commitment, as reflected and appropriately so on the agenda items for this year, will need, I think, my opinion, to be accompanied by, or should be accompanied by, a revamped communications program, and would love to place on the agenda a review of our communication strategy. And indulge me for 30 seconds, let me say why I think this is necessary. NCDs is primarily behavioral. It is more around social sciences as opposed to clinical sciences. We in PAHO, as well as the WHO and in our respective countries, have done an excellent job in providing the facts based on clinical research to highlight how decisions impact health outcomes. But those facts are necessary, but I dare say not sufficient for influencing behavior. And indeed, the agenda around behavioral change to support health-seeking activities has to be countered against the new environment of communication, the social media environment, the significant expenditure that industry places on communicating, and the optics and the packaging of communication, the advertising, the marketing. So as we confront policies and legislation around things like tobacco, front of package labeling, school nutrition, drinking water as opposed to sugary drink, it is not going to be sufficient in this post-COVID era to just be accurate with the clinical sciences. Much more will have to be done to package and deliver communication in a way that drives behavioral change. And so, Madam Director, I know you share that view. You and I have spoken on it, and I thank you for the opportunity to deliver it in this context. I would like to propose an agenda item that captures a review of our communication arrangements to reflect a more modern and stronger attempt at gaining attention and influencing behavior. And I would suggest humbly that this be captured under an item called Communication for Public Health Advancement. Thank you, delegates, for listening. And I now open the floor to the plenary for discussion. I see the United States and then Uruguay.
Thank you, Mr. President. And as this is my first opportunity to speak, to congratulate you on your election and to thank you for the opportunity. With respect to the items on the agenda, I think we would like to just be assured or to request that with respect to the Health Workforce 2030, that we could add an update on the America's Health Corps and the work between the America's Health Corps and the Pan American Health Organization, especially the PAHO Virtual Campus. With respect to the director's point on the revolving fund and positioning it for local and regional manufacturing, we absolutely agree that that's critically important. We would just note that there is an important private sector component to this agenda item, with the private sector being one of the main investors in local and regional manufacturing and with respect to providing the technology and the intellectual property to support that. We would want the intellectual property protections for our manufacturers, but we think that there are ways in which they would work with local and regional entities in the Americas to promote investment. And so we would like to note that with respect to local and regional manufacturing. And I'm not sure with respect to this, if there would be the opportunity to have a report out on the regulatory cooperation between countries that will be very critical to local and regional manufacturing as well. I think we need to have appropriate regulatory capacity and exchanges on local and regional manufacturing. And the last piece, Mr. President, on your requests for communications for public health advancement, the United States completely agrees. That's a very good suggestion. I don't know if we need to second it or not, but formally we will. And I would just say that with respect to some of the new and innovative issues relating to public health and promoting good habits, healthy eating. There are a lot of partnerships I know that are happening with sports teams and influencers and sports leagues that allow for the reinforcement of good habits, healthy living, exercise, and those things. So we would suggest that maybe PAHO think about that. There's the National Basketball Association, the Women's National Basketball Association, the soccer leagues, football, excuse me. But I would just say that there are a lot of ways we could work together. Thank you.
Thank you very much, United States. I now yield the floor to Uruguay, then followed by Argentina.
Muchas gracias, señor presidente. Primero, felicitarlo por este rol que cumple y agradecer a todos también por este lugar que Uruguay va a ocupar a partir de hoy. Quería retomar su propuesta de comunicación. Es más que oportuno en los tiempos que nos toca transitar poder desarrollar una comunicación 360, una comunicación en la cual se utilizan todos los medios de comunicación, y más si en esta propuesta de trabajo queremos apuntar a los más jóvenes. Es importante aterrizar el lenguaje y hablar en los idiomas y en las plataformas donde hoy la gente está, sin desechar cualquiera de ellas, por más que a veces nos cueste la distancia, pero los jóvenes están y los adolescentes están en TikTok, en Instagram, en Twitter. Bueno, hay varias plataformas que creo que hay un gran desarrollo y que en la región la pandemia por COVID-19 nos ha hecho muy creativos en la comunicación y tenemos muchas lecciones aprendidas que poder transitar en ese camino. Así que celebro que se pueda tomar este tema y que la comunicación sea tomada también como una herramienta transversal a las políticas que queremos que sean efectivas y que lleguen a aquellos estamentos sociales que a veces, cuando hablamos desde los ministerios de salud, es muy difícil que el lenguaje sea claro, así que es un excelente ejercicio poder tener un trabajo específico en comunicación. Muchísimas gracias.
Thank you very much, Uruguay. I now yield the floor to Argentina, followed by Chile.
Gracias, señor presidente. En primer lugar, me sumo a las felicitaciones de los colegas por su designación como presidente. Ahora Argentina realiza esta intervención en representación de Argentina, Costa Rica, México, Uruguay y Paraguay. ¿Me escuchan? Estoy muy lejos. Perdón. La Argentina desea proponer la inclusión del punto en el orden del día de la sesión número 172 del Comité Ejecutivo, acceso a servicios de salud y reproductiva. Nuestro país entiende que garantizar el cumplimiento efectivo de la salud y los derechos sexuales y reproductivos de todas las personas es una prioridad a nivel regional, nacional y global. En este sentido, apoyamos la implementación del Plan de Acción de Salud de la Mujer, el Niño, la Niña y Adolescentes 2018-2030, en línea con los ODS, la Agenda de Salud Sostenible para las Américas y la Declaración de Astana. El plan de acción se especifica que para la estrategia mundial se requiere el logro de la salud física, mental, del bienestar para todas las mujeres, niños, niñas y adolescentes, con acceso universal a la atención y servicios de salud, incluidos los derechos y la salud sexual y reproductiva, oportunidades sociales y económicas y su plena participación en la formación de sociedades prósperas y sostenibles. Por su parte, los Estados miembros se comprometieron a avanzar en los objetivos de ODS, donde su meta 3.7 se establece que para el año 2030 se debe garantizar el acceso universal a los servicios de salud sexual y reproductiva, incluidos los de la planificación de la familia, información y educación y la integración de la salud reproductiva en las estrategias y los programas nacionales. También la Declaración de Astana. Los Estados partes se comprometen a brindar una atención primaria de la salud que ofrezca una amplia variedad de servicios de cuidado, incluyendo los derechos sexuales y reproductivos. Además, establece que la atención primaria será accesible, equitativa, segura, de alta calidad, integral, eficiente, aceptable, asequible, estará disponible y presentará servicios integrados, continuos, centrados en la persona y que tienen en cuenta las cuestiones de género. Recordamos que la garantía de estos derechos humanos básicos se enmarca en los tratados internacionales y en los compromisos específicos para la protección de las mujeres, niñas, adolescentes y otras personas con y sin discapacidad. Cumplir con las obligaciones asumidas en esta materia y proteger los derechos sexuales y reproductivos permitiría alcanzar mayores niveles de justicia social y desarrollo para los países y para la región. Además, contribuye de manera sustancial en la eliminación de la morbi-mortalidad materna y la reducción de la tasa de fecundidad en la adolescencia, que en nuestra región continúa siendo de las más altas. Dichas problemáticas aumentan los niveles de pobreza y ensanchan los márgenes de desigualdad social, siendo las mujeres, adolescentes y niñas quienes más padecen de dichas consecuencias. La defensa de los derechos sexuales y reproductivos como derechos fundamentales dentro del marco normativo internacional de derechos humanos tiene como piso insoslayable brindar herramientas para que las niñas, adolescentes y jóvenes tengan la posibilidad de desarrollarse plenamente en autonomía y libertad por una vida libre de violencias. Por ello, y con el objeto de incorporar las demandas y luchas de la sociedad por la igualdad, la no discriminación y la erradicación de violencias por motivos de género, en sintonía con los marcos normativos nacionales e internacionales, es que solicitamos la inclusión de este punto. Muchas gracias.
Thank you very much, Argentina. I now yield the floor to Chile and then again to the United States of America.
Muchas gracias, señor presidente, y aprovecho esta instancia también para felicitarlo por el nombramiento en la presidencia. Y en relación a la propuesta que hizo usted, ministro de Jamaica, de incluir el tema de la comunicación, nos parece muy relevante y muy valioso que haya surgido esta propuesta. Entendemos que el tema comunicacional es una de las principales lecciones aprendidas en este proceso de pandemia, por una parte, para lograr la comunicación obviamente efectiva con la población respecto a las políticas que se están implementando, pero también para hacer frente a la gran desinformación que desborda las redes en estos días. Por lo tanto, también hemos podido identificar que no basta solamente con entregar datos, que el día de hoy también se requiere lograr una comunicación probablemente más simple, pero o de qué manera poder llegar de mejor forma a la población respecto de las políticas que se están implementando. Por lo tanto, valoramos enormemente la propuesta de incluir este ítem en la agenda. Por otra parte, también respecto a la propuesta que ha presentado nuestra colega de Argentina, nos parece muy importante también poder incluir el ítem en la agenda del acceso a servicios de salud sexual y reproductivo, así que aprovecho esta instancia también para secundar la propuesta argentina. Muchas gracias.
Thank you very much, Chile. I now yield the floor to the United States of America, followed by Canada.
Thank you, Mr. President. We would like to second the proposal made by Argentina for the agenda item and very much support its inclusion. Very much support its inclusion. Thank you.
Thank you very much, United States of America. Now yield the floor to Canada.
Thank you, Chair. As it's my first time speaking, I'd also like to extend my congratulations on the assumption of your role. Canada would like to thank Argentina for their proposal and is happy to support the addition of this proposal to the Executive Committee agenda as an informational item. Canada strongly believes that access to sexual and reproductive health and rights is critical to advancing health, gender equality, human rights, and supporting the empowerment of diverse groups of women and adolescent girls. Lack of attention to SRHR contributes directly to maternal mortality, poor health, and the disenfranchisement of women and girls. Canada remains committed to supporting access to the full range of sexual and reproductive health and services and information, and looks forward to reviewing this informational agenda item at the Executive Committee in June. Thank you.
Thank you very much, Canada. I see no other indication of an interest in contributing from the plenary. So I will now hand over to Madam Director for any comments that she may have.
Thank you, Mr. President. So the Secretariat concludes that you have accepted these agenda items, including the agenda item on communication for public health advancement and an information document on access to reproductive health services. And I hope that I have correctly interpreted the comments of member states. Please note that in preparation for these agenda items for the governing bodies, we will consult widely with member states to ensure that any document that we present reflects the views and of member states and also strategies for moving forward. Thank you very much.
Thank you very much, Madam Director, and thank you to delegates for their comments on communication and for all the comments that have been made. I would like to inform the committee that there is no need to adopt a resolution. The approved topics will appear as a decision in the final report. So we move on now to item 5.1, update on the Master Capital Investment Fund and on the Master Capital Investment Plan implementation. I would like to bring document CE 171/6 to the attention of the committee and invite Ms. Kristen Beck, Director of Administration of the Pan American Sanitary Bureau, to come to the head table and present.
Good afternoon, Mr. President. Let me also extend my congratulations. Good afternoon, Madam Director, members of the committee, and colleagues. It's a pleasure to be here with all of you this afternoon. As reported in the update on the Master Capital Investment Fund, document 170/24, dated 12 May 2022, the Secretariat has initiated a partial renovation project based on the property condition assessment conducted of the headquarters building in 2014 and 15. That report identified 13 projects and noted that the original electrical, heating, and cooling systems of the building were well past their recommended useful lifespan and therefore needed to be replaced. Due to funding constraints, only limited renovations have taken place since the time of the assessment. However, in the second half of 2021, with personnel teleworking during the pandemic and an improved financial situation, the director decided the time was right to undertake the renovations that would most favorably impact the health and well-being of personnel. Thus, the renovation currently underway includes the following: replacement of original electrical equipment throughout the building, replacement of the original heating, ventilation, and cooling systems, otherwise known as HVAC, on floors 2 and 10, and in the restrooms on all floors, and upgrades to the audiovisual systems and lighting of the conference room facilities. These renovation projects will reduce the risk of equipment failure, improve indoor air quality and circulation, and modernize conference facilities and technology to support hybrid meetings. The total projected budget for this renovation project is $28.7 million. Of this amount, $20.4 million will be funded by the Master Capital Investment Fund. The details are included in the document before you. The remaining $8.3 million will be funded by other flexible funding sources. Despite this substantial investment, the headquarters building will require additional priority renovation projects in the near future, also described in the document. The current renovation project is expected to run through mid-2023. Personnel whose offices are located on the affected floors of the main building have been relocated to the Virginia Avenue building across the street. A project of this size and complexity takes patience and perseverance on everyone's part. Nevertheless, we are excited about the improvements to PAHO's historical headquarters building and appreciate the foresight of the director who prioritized creating a healthier and more functionally up-to-date work environment for PAHO personnel and visitors. We look forward to hosting you at future governing bodies meetings in PAHO's newly renovated building. The executive committee is asked to consider approving the proposed resolution. Thank you very much.
Thank you very much for that. Big plans in the works, which is good. I would now like to open the floor to the plenary for any comments on the report that was just given. Okay, I therefore see no need for Ms. Beck to comment on the no comments. And so I will hand to the director for any comments that she may have.
Thank you, Mr. President. We do not take frivolously the expenditure of scarce resources of the organization. Ms. Beck has been she has smoothed this quite nicely, but conditions were severe on the second floor and the 10th floor. Those floors have never been renovated for the 60 plus years of the organization. Floors 2 to 9 have been renovated. In the winter, on the 10th floor, we have to wear our winter coats because it is so cold. And in the summer, we have to have individual air conditions because it is so hot. In the winter, the ice forms on our windows. And the air quality was bad. And given COVID-19 and the need to ensure good air quality, this had to be looked at. Asbestos were on the 2nd and 10th floor, and we also had to deal with this. Initially, the costs were much less, but with the supply chain issues and post-pandemic, the cost increased. So we are still looking to because we have petitioned WHO for some resources to help us with those renovations. We were expecting word from WHO, and we're hoping that it will be positive as well. So this is an investment, not only in the building, but an investment in the health and well-being of the staff of the organization. And I thank member states for taking this into consideration and for not raising any objections to that. We've waited a long time, and I think this is an opportune time to do it. And it will be my gift to the PAHO staff. Thank you.
Well, I think that if I may. Sounds like a vote of confidence there, Madam Director. If I may add to the justification, I think to be a hemispheric health authority, if you will, and not symbolize both in real and in appearance, health and wellness, by having windows that are compromised and asbestos would be a grave injustice to the message that we seek to promote among member states and among our population. So I certainly think that this should have happened a long time ago, but we're happy it is happening now. So thank you very much and commendations for your leadership on this. Thank you very much. I now ask the rapporteur to submit the proposed resolution.
Gracias, presidente. Buenas tardes. Proyecto de resolución. Uso del saldo del excedente de la implementación del Sistema de Información Gerencial de la OSP. Párrafo preambular 1. Habiendo examinado la actualización sobre el Fondo Maestro de Inversiones de Capital y sobre la ejecución del Plan Maestro de Inversiones de Capital, documento CE 171/6. Párrafo preambular 2. Reconociendo que los fondos del excedente de la implementación del Sistema de Información Gerencial de la Oficina Sanitaria Panamericana, PEMIS, por su sigla en inglés, son necesarios para la ejecución del curso del Plan Maestro de Inversiones de Capital. Párrafo preambular 3. Tomando nota de que se ha delegado al Comité Ejecutivo la facultad de examinar y aprobar propuestas para el uso de los fondos excedentes de la implementación del PEMIS, de conformidad con la resolución CSP 28.R16/2012 de la Conferencia Sanitaria Panamericana, resuelve. Párrafo operativo único. Aprobar la asignación de $2.102.000 americanos al saldo del excedente de la implementación del PEMIS al Fondo Subsidiario de Mantenimiento y Mejoramiento de Bienes Inmuebles del Fondo Maestro de Inversiones de Capital, a fin de que sea utilizada en las obras de remodelación en curso. Es todo, señor presidente.
Thank you very much. The floor is open to the plenary for any comments, any discussion on this issue. Okay, I see no indication of an interest in commenting. I therefore, with no objections, I declare that the resolution is adopted. Oh, yes. I always wanted to do that. Sorry for doing it twice. Okay, let's proceed to the next item 6, other matters. As we are dealing with other matters, I asked the director whether she wishes to put any other matter before the executive committee. Madam Director.
Thank you, Mr. President. I think what we have is sufficient. So there's no more to add. Thanks.
Okay, and are there any other matters? I yield to the plenary. Any other comments or any comment on any matter? Oh, I see the United States.
Thank you, Mr. President. Before we end this very important session with both the director and the deputy director of PAHO being women, I think it's important to note that we've discussed at the sanitary conference the importance of women in the healthcare field. Over 60% or more of the healthcare workers in our region are women. They have dedicated not only themselves to the promotion of health and the health and well-being of others, but also to their families. And many of them are struggling to be able to afford keeping food on the table, taking care of the family, and doing their job, which is very difficult. As we move into this next year, we would propose that we discuss how we can ensure that women in the healthcare field, especially in the Americas, are able to get equal pay for equal work, are able to have opportunities for advancement, are able to have educational opportunities. We think this is critically important. And the time for discussion has long passed. We need to move to actual policy recommendations to make this a reality. So we would want to work with all the countries in the room here and all the member states of PAHO to really promote this idea. It's part of the America's Health Corps, but it's something we all need to do each and every day as health policy experts, as political leaders. And the time is now. The time is actually it was quite a long time ago to do this, but we really need to commit to ensuring that women in the healthcare field are given what they deserve and the opportunities, and the time is now for us to recommit to this. So before we end the session, we would just want to bring this to the floor for consideration as we go forward. And it really should be something that is incorporated in all the policies of PAHO to make sure that in every aspect of our work, we're focusing on how we can ensure that women are given equal opportunity and equal access to the same benefits and opportunities of others. Thank you very much.
Thank you very much, United States of America. I think it's worthwhile comments made, very valuable. I would like to say that from my vantage point as a Minister of Health in Jamaica, during the most turbulent health threat that we have faced in 100 years, our frontline workers at the community level in the accident and emergency wards were overwhelmingly, I dare say, 80% and above women. And so not just is there a point to be made of the participation generally, but in terms of the risk profile within the spectrum of public health, our women normally are the ones facing the greatest threat. So I do share that comment, and I will say that it will be reflected in the committee's final report. And so if there are no other comments, I see no. Oh, Madam Director would like to comment.
Thank you, and thank you, United States of America, for really raising this issue. I think that under the health workforce agenda item, we could highlight this, and also in our gender equality cross-cutting program, we could include this with a specific focus on women healthcare workers. Thank you.
Thank you very much, Madam Director. And so if there are no comments on item 6, I move to item 7, which is closure of the session. And I ask Madam Director for her final remarks.
Thank you. Thank you, Mr. President, and good afternoon. And let me say I'm impressed with how quickly we've gotten through this agenda. And let me thank, and it's not because you are not participatory or participative, but thank you that you have seen the wisdom in some of the agenda items that we brought before you, but also the agenda items that you have presented to the Secretariat. This is my last executive committee meeting as well. I have many lasts now, but let me say that the executive committee is an important governing body committee. It is you who gets to look at particularly the policy items. It is you that shape it. It is you that reviews the resolutions that go before the Directing Council or the Pan American Sanitary Conference. And the success of the Directing Council and Pan American Sanitary Conference, the ease with which the agenda items can be reviewed and resolutions passed, depends significantly on how diligent you have done your work as the executive committee. Over the years, PAHO's executive committee has played a major role in moving the agenda, and particularly on the policy matters, but importantly also with the administrative, financial, and budgetary issues. So I want to thank all of the executive committees and through you, but also to commend you on having accepted the responsibility to be part of this group and to wish you well. You are the watchdogs for PAHO, watchdogs for accountability. You are the watchdogs for transparency. You are the watchdogs to ensure that the Secretariat is actually addressing the priorities of member states. And so yours is an important role, and I want to wish you well. Thank you very much.
Let me also take the opportunity to, in closing, to recognize you again, Madam Director, for your leadership. This represents, as you say, your last executive committee oversight, participation, leadership, but certainly not your last participation in public health matters. And I'm sure we will see you here in the future. But we want to commend you and place on record your contribution. And I know I speak on behalf of all the members at this level of the executive committee. And we certainly wish you all the best. To members who are here who were very efficient in their participation or lack thereof in terms of comments, that is, I want to thank you. I think we have an excellent agenda that is relevant. So it's now up to the work that will take place after this with the changes that will occur, which we are confident will continue to grow and expand the influence of the Pan American Organization for the benefit of the people of the Americas. The only thing left for me to say is that the malls close at 8. There are good restaurants around, and you have an hour or two to relax before you embark on your next phase in preparation for your return home. Have a safe trip home and good luck to all, and long live the Pan American Health Organization. God bless.
When we are here, you told us